this very important special meeting to conduct. We have some important matters to discuss related to the profession in relation to the COVID crisis and discussion and possible decisions relating to the futures of the newest members of the profession. So let's get to it. Let's move first to item one, the calling of the quorum. I'll hand it over to the Secretary, Dr. McIntyre.
Thank you, Mr. Mordomi. Okay, we will start with Dr. Wong. Are you present?
Present.
Dr. Turetsky?
I'm here.
Dr. Garcia?
Present.
Ms. Brandvine?
Present.
As Dr. McIntyre, I am here, present, and Dr. Calgucci, not here yet. Mr. Mordomi?
Present.
That makes 6 members of the panel here, and that does create a quorum for us. Thank you.
Great, thank you very much. I would like to announce we will be taking some of the items out of order for the convenience of some of our speakers, and to there's probably a little bit more logical order than that published on the agenda for our decision making. So let me go through the order that which we would like to conduct our business. Our next item will be public comment for items not on the agenda. Then we will introduce our new board member. And then we'll skip to item 5, which is discussion of presentation of optometry colleges, school deans, and California Optometric Association regarding the need for accommodations and impact to students. After that item, we'll return to item 4, presentation of the Office of Professional Examination Services. Then we'll go to item 6, discussion of alternatives to the NBO exam for 2021. Then 7, discussion of consumer applicant employment impacts and possible actions to adopt a plan for alternative competency verification. And then the final item will be adjournment. So with that, unless there are any objections, great. Let's move to item 2, public comment for items not on the agenda. Madam Moderator, would you please open up for public comment?
This is the moderator, and at the direction of the board, I have opened the Q&A feature. If you would like to make a public comment, please click on the icon located at the bottom of your screen and type "I would like to make a comment" and send to all participants. I will take all comments in the order they are received. You will be given 2 minutes to make your public comment and provided a 10-second warning. I will take all comment requests in the order they are received. I will pause a moment to allow individuals time to access this feature.
So this is for items not on the agenda. I imagine there will be speakers for items that are on the agenda, and we'll take your comment when we reach that item.
Correct. So just for agenda item number 2, we do have an individual identified as Christine Schultz. Your microphone has been unmuted.
Schultz, thanks so much for taking my comment. I just wanted to make sure that you're going to allow for a public comment after each agenda item. We have Dr. Cockrell who's calling in and is hoping to be able to speak right after we speak on agenda item number 5. Thank you.
Thank you, Ms. Schultz. We'll make sure we allow for that public comment. And I'm sure our council will make sure I do that as well. All right. So hearing no other requests for public comment, let's move on to item 3, introduction of new board member. On behalf of the board, I'd like to welcome and introduce Dr. Jeffrey Garcia as the newest member of the board. I think we're very, very lucky to have Dr. Garcia on the board. He is a civic leader even before he arrives on the board. service in our military, service with the Chamber of Commerce, the Lions Club. He's a very active member of his community. And I was, even this COVID crisis, I was very fortunate to get a tour of his Lemoore clinic. And you can get that tour too if you go to his website, and he has a virtual tour of his offices. He has beautiful, beautiful and a beautiful, beautiful optometry practice. So welcome, Dr. Garcia. You're welcome to have some words of introduction if you wish.
Okay. First of all, I want to thank all of you for welcoming me to the board, especially President Mark, Glenn, and David for calling me a week or so ago, welcoming me. So that was a nice surprise, but it made me really feel like a part of the team, even though this is my first meeting. Thank you, Shara, and your crew for helping me onto the board. You have a great team that made it very easy as well. Just a little bit of history about myself, other than what Mark has already mentioned. I've actually been wanting to be on this board for many years, probably over 15 years, but because of vacancies and life, the timing never worked out well. But I'm glad that I finally found that opening onto the board, and I look forward to participating. Hopefully I'll bring a little bit of a different perspective to the board. I'm from San Diego, but I actually have lived here in Central California for the last 30 years or so. I practice and live in Central California, which is south of Fresno, north of Bakersfield. And this region is unique in that it's one of the fastest growing areas of California. It has one of the highest per capita Medi-Cal rates, and we have significant healthcare access issues. So it's unique demographically, geographically, and culturally in many ways. So hopefully I can bring a little bit of a different perspective to the group with that respect. As Mark mentioned, I do have 3 offices here in Central California. I do practice with 3 other optometrists, 22 staff members, and I'm proud to say that I'm an adjunct professor for Western and for SECO. So we do have externs come through every 3 months to our practice, which has been something we've done for about 3 or 4 years, but I've really enjoyed working with the students. It really keeps us on our toes, keeps us sharp, and it's really great to be able to work with the next generation of optometrists and see what they're learning and kind of give them a different perspective of private practice and kind of expose them to Central California. In fact, I did hire 2 of the students that came through my practice. So we do have two new young graduates in our office, and I've been able to facilitate new graduates finding jobs here in the Central Valley. So it's been a win-win all around as far as working with the colleges. As Mark mentioned, I am a Navy veteran, so I'm proud of my service there. And I also serve, just for full disclosure, on the COA Ledge Committee, and have been proud of the work that we've all done there. I was able to work closely with Assemblyman Salas on our last scope expansion bill here a couple years ago. He's our assemblyman, so I do have a little bit of experience there, and Christine has been great working with her with the COA. So just looking forward to working with each of you, becoming a part of this team, and doing great things for the people of California and for the profession. So thank you all for your welcome.
Thank you, Dr. Garcia. Those were very nice comments. I'd like to open the floor up to any board members if they wish to comment as well or ask questions. Seeing no waving of hands, I'd like to open up the floor to any public comment.
This is the moderator. I have opened the Q&A panel for comments regarding agenda item number 3, which is the welcome of Dr. Garcia. If you would like to make a public comment, please click at the bottom of your screen, the Q&A icon, and submit. I would like to make a public comment. Mr. President, at this time, it does not appear we have received any requests. I take that back. One did just come in. And by the name of Elizabeth Hope, your microphone has been unmuted.
Good afternoon. I wanted to just extend my gratitude to Dr. Garcia and say thank you so very much for your service and everything that you're doing. We really appreciate the opportunity to have you serve as a mentor for our students from Western U. Thank you.
Thank you, Dr. Hoppy.
Fantastic.
There are no additional requests. Would you like me to close this feature?
Yes, please.
Feature has been closed.
All right, let's move on to agenda item 5, the discussion of presentation by the Optometry College School of Deans and the California Optometric Association. Executive Director Murphy, Executive Officer Murphy, how do we have a particular lineup of the presentation? You're on mute.
Yes, sorry that we do. We are fortunate to have all three of our deans from Western University of Health Sciences, Marshall B. Ketchum, Southern California School of Optometry, and the Berkeley School of Optometry. I believe they each wish to make a comment, and we'll start with their comments and then move to the presentation of student letters and additional comment from Christine Schultz, Interim Executive Director of the COA.
That's fantastic. I don't want to put any strict time constraints on the presentations because I very much want to hear what everyone has to say, and this is a very important topic. However, what is our kind of ballpark estimate for these presentations total in terms of time?
I think that, we've been through several hearings and committee meetings on these. I think that the deans have a very succinct and very clear view of the statement of problem that's been presented to them by their students. And I would say that if we were to take 20 minutes, so for this item to move to our next item at approximately 125. 135, 140.
All right, let's see how it goes. I very much want to hear what the deans and the COA have to say about this topic. So let's get started. Who's first?
This is the moderator. I have promoted Christine Schultz to a panelist.
Does COA want to go first, or are we having the deans go first?
This is Christine. Our intent was to have the deans go first.
With that, this is the moderator. I will go ahead and promote Jennifer Coyle to a panelist, as well as Dr. John Flanagan. Both were promoted.
Good afternoon, everyone. This is Jenny Coyle.
I apologize, Dean Coyle. If we could also be sure to elevate Dean Elizabeth Hoppy. Thank you.
She has been promoted.
Thank you.
Hey,
Coyle, please proceed.
So, first of all, thank you to the board for your openness and willingness to hear our concerns. It's a pleasure to meet you, even in this unusual scenario here on the computer. So, as you've heard, we do have significant concerns about the upcoming future of the eye care workforce during these unprecedented times. As the Dean of the Southern California College of Optometry, I am representing the 99 graduating students from our Doctor of Optometry program coming up in May of 2021. So as described in the materials you've received from the COA and their previous presentation, we are greatly concerned about the conditions and accessibility primarily of the 3 parts of the national board exams that are required for licensure in our state. As a very quick recap, and I've been elected to do the history lesson here, the class of 2021 were scheduled to take part one of the national boards back in March at Pearson VUE test centers across California and across the nation. But those were canceled in some instances the night before a scheduled exam, secondary to COVID-19. In June, new test dates were announced for a 3-week span from late July to early August, and gratefully another 3-week period has been opened up in November. The targeted summer administration, as you can imagine, was definitely preferred by our students because they are scheduled to take part 2 in December. So those that take part 1 in November would then turn around and need to take part 2 a month later. Although the sites were opened up in late July and early August due to state restrictions, Pearson VUE test centers were only able to accommodate about 50 administration. So some of our students in California were not able to find a slot until the November administration. I had students who were able to find a slot at a Pearson VUE test center in a different state. For example, I have one student who had to fly to Texas to take part 1. We're concerned about the November administration. As you can imagine, if there is a resurgence of this virus, will we be faced with stay-at-home orders again and those test centers suddenly close? And then likewise, we are concerned about our students being able to actually access part 2 in December if the same scenario occurs. Also, at the top of our worry list is the fact that our students are really in the untenable position of having to travel to Charlotte, North Carolina to complete the third portion of the MBEO sequence, because currently we only have one test site in our country. So during this public health crisis, our students really have no choice except to take a high stakes exam that is basically 7 states and 2,400 miles away from us. And then, as you can imagine, there are scenarios that add to the complexity of the situation because some have health conditions that put them in high-risk categories, and some live with individuals who are at high risk. And then we have some who have disabilities that might impact their ability to access air travel. So in normal times, unique scenarios do occur and they do provide challenges, but they are definitely exacerbated in a pandemic. For example, I have a student who's unable to fly and must drive to Charlotte to take part 3. So they need to take several days off from clinic just to make the minimum 35-hour trip, assuming no traffic getting across our state, to get there. And it's another 35 minutes back, or 35 hours back. So basically, these circumstances do create an unequal playing field for those candidates who already have access issues. And then there is the risk if they are exposed to an individual that has tested positive for COVID-19, or if they suddenly exhibit symptoms of their own, they will then be forced to quarantine, possibly up to 14 days, which would require then missing another 2 weeks of direct patient care of clinic. And ultimately, it could delay their graduation. At the end of the day, and this is kind of the reality check, or at least at the end of their educational journey, these bright new doctors are facing an unknown financial reality. Many are graduating with $200,000 to $300,000 in student loan debt, and their ability to obtain their license to practice optometry in the state of California upon graduation is critical because most of them will be required to start paying back those student loans by November of 2021 at the latest. So we believe, the 3 deans, that an alternative pathway to licensure that does not immediately require national board exams would allow these graduates to enter the healthcare workforce after graduation from one of our accredited Doctor of Optometry programs. Our students, as you know, spend 4 years in optometry school. They have a very rigorous curriculum. It includes constant assessment. In other words, we are constantly testing them on a regular basis, and that includes regularly demonstrating competency of clinical skills and clinical thinking. Our students provide direct patient care to over 1,000 patients during their 3rd or 4th year, and they're graded on their performance of those patient interactions. And ultimately, the way that they perform is important, and they must pass before they can move on from year to year in our curriculum or move on in advance in clinic. So we believe, and we're asking you to consider a temporary licensure pathway that would allow them to provide essential eye and vision care immediately after graduation, and also provide time for them to safely complete the necessary national board examinations when the public health crisis subsides. So I appreciate your time and your willingness to allow us to be here in front of you. And I thank you for our leadership in our state. And thank you, Dr. Garcia, for joining the board. I believe Dr. Flanagan will speak next.
If I can jump in, I think the order, unless Dr. Flanagan wants to go next, I was going to jump in. Is that okay?
That's fine with me. Board members, I suggest we listen to all the three deans, and then we can ask them questions after their presentation.
Thank you so very much. I am very grateful for the opportunity to address the members of the state board regarding this very important topic. And thank you so much to Dr. Coyle for setting the stage and talking a little bit about the history of what has transpired. I'm Dr. Elizabeth Hoppy, and I'm the founding dean of the College of Optometry at Western University of Health Sciences. I need to disclose to the board that I currently serve as a member of the board of directors for the National Board of Examiners in Optometry, and I have been a member of the NBEO board of directors since 2013. I've been elected to every position in the board's leadership structure, including secretary treasurer, vice president, president, and past president. Prior to serving on the NBEO board of directors, I've served as an item writer, a member of the development committee, and a member of the examination council for more than 30 years. I understand the value of testing. I sincerely believe in the value of testing. Testing is vitally important to ensure that our doctors of optometry are competent to enter into practice. And that's why at Western University of Health Sciences and at every other school and college of optometry in the country, we engage in frequent and ongoing longitudinal assessments of every student. Over the course of the four-year curriculum, graduates of Western University of Health Sciences College of Optometry in the didactic portion, which includes the lectures, laboratories, skills development, and case-based learning, every student will be tested with a total of 186 low-stake quizzes, 83 high-stake comprehensive cumulative examinations, and 14 competency or proficiency practical examinations. Over the course of the four-year curriculum, graduates of Western University of Health Sciences College of Optometry in the clinical education and patient care services courses, our students will receive over 100 written assessments that evaluate 8 different domains with 36 detailed competencies, such as, but not limited to, case analysis, technical skills, knowledge base, clinical thinking, and patient management. In addition to those written evaluations, students are also graded and assessed with verbal feedback on every single patient encounter, resulting in a total of nearly 2,000 additional assessments. In every school and college of optometry, we provide longitudinal testing and evaluation with multiple data points over the course of 4 years. And as I'm sure all the members of the State Board of Optometry know, when making evidence-based decisions, longitudinal data with multiple measures vastly outweighs single measurements made at one single occasion at one point in time. Now, I know that I and my colleagues would never advocate for a pathway to licensure with no testing. And I'm asking the members of the Board of Optometry to recognize the extensive testing being already done by the schools and colleges of optometry as being valid, reliable, and appropriate indicators of competency to enter into the practice of optometry. The creation of a pathway to temporary licensure would allow greater access to essential eye care and essential vision care services for the residents of California. And it would allow for better serving the needs of the public, many of whom are already experiencing disparities in access to care and disparities in health outcomes. Thank you so very much for your due consideration of this vitally important concern. And I'll ask our colleague, Dr. John Flanagan, to share his thoughts next.
Thank you, Dr. Coyle, and thank you, Dr. Hoppy. My name is John Flanagan. I'm Dean of the School of Optometry at the University of California, Berkeley. I would like to thank the State Board for this opportunity to once again address you on this very important consideration of emergency planning for a pathway to licensure. I also should disclose that I'm currently president of the Association of Schools and Colleges of Optometry. As you've heard from my colleagues, there are key issues to our plea for a temporary license mechanism and accessibility for our students to their chosen career of optometry. We have great concerns for the class of 2021. It is not an unlikely scenario. In fact, it's a likely scenario that in the winter that we're about to face, the winter of 2021, there is likely to be an increase in COVID-19 in combination with a harsher than usual flu season. The chances of there being closure of our one national test site in Charlotte remains, in our consideration, high. And as Dr. Coyle pointed out, at 2,400 miles away, it's difficult and difficult for access for our students, even as we speak. So we should consider the need for emergency planning for the event of closure, but also for consideration of the danger that our students currently face needing to travel to take their examinations at this current time. We can all make the case that currently on graduation, the level of outcome clinical competence on graduation is adequate for protection of the public in terms of the clinical competence of our graduating students. I'd like to congratulate the National Board for all they've attempted to do to ensure that our students can continue taking all parts of the National Board. But I think that we all realize that this is a very tenuous situation and one that they're struggling to be able to control, and certainly were not able to adequately control as this pandemic rolled out. And we do believe that it's unlikely for them to be able to control test centers and maintaining access to test centers in the event of increased COVID-19 and further shutdown across the country. I think the need for a temporary license is not a national board problem. At this stage, it's a state board problem. And again, thank you for calling this meeting for us to be able to address that. We need to keep our students safe. We need to ensure a pathway to licensure within the career that they have chosen, the profession of optometry. I do want to address one issue that was brought up both at the last state board meeting and in some recent questions and correspondence, and that was about current pass rates for national boards and in particular Part 3. most recent national pass rate, ultimate pass rate, was 93% nationally. And for my school, the University of California, Berkeley, over the last 3 years, we're anywhere between 94 and 98% ultimate pass rate on the national boards. So again, would like to thank you for giving us this serious consideration of finding a pathway for licensure and temporary licensure in particular in this time where we really need to plan for emergency. Thank you very much.
Thank you, Deans. Actually, before I open up the board, I would like to hear from Ms. Schultz, the COA representative, because I'm sure we have a lot of questions for the deans, but I don't want to give Ms. Schultz short shrift. So I want to bring her in now.
Great. Well, thank you so much for the opportunity to speak. Christine Schultz, representing the California Optometric Association. The California Optometric Association is extremely concerned about forcing students to travel to take their national board tests during the COVID pandemic. The board needs to act to protect students from risking their health and their lives. I think Dr. Kevin Alexander put it best. We're at war with this pandemic. And in a war, the usual standards don't apply because they're impractical. As the college has explained, students' clinical skills have been tested numerous times during their college experience. They don't graduate if they're not competent to practice. The testing they receive in school is much more comprehensive than a one-day test that may evaluate how they're feeling that day more than their clinical skills. The NBEO statistics make it seem like there's no problem, but the fact that graduates in 2020 took and passed the NBEO is not a reason for inaction. These students had no other option. COA did a survey that we conducted last month of students. 93% of students who responded said that they are worried about catching COVID when taking their national board tests. Over 50% of those students were worried a great deal. The easiest way to address this problem, we believe, is to allow the colleges to attest to student competency while the pandemic is ongoing and require the NBEO for the class of 2021 to not have to take the NBEO. This has been done in Oklahoma. It can be done here in California. If the board feels it must require the NBEO at some point, we know it will be more difficult for these graduates to pass. But please don't let this concern stop you from allowing a delay in the test. Many of the students that I spoke with were very clear. They wanted the option to have a delay in taking the NBEO until the COVID numbers were down. One student even told me he'd rather do extra study sessions next year than put my family in danger now. Another reasonable option, if you don't want to go that route, is to create a temporary licensure where the doctor would be allowed to practice under supervision. And then once they take the NBEO, then they'd be fully licensed. Some states have the authority to waive the NBEO on a case-by-case basis. If you do nothing else, the board must consider this approach at the very least. No action by this board is not an option. If the virus mutates and becomes more deadly, the board is going to need more flexibility in its regulations. We need to prepare now for this possibility. California universities have been closed to classroom study. It's simply wrong in this environment to ask our students to risk their health and expose those they love to the consequences of this pandemic. It's wrong, and we can do better. Thank you for your time, and I'm happy to.
Thank you, Ms. Schultz. I will next open the floor up for comments or questions by the board members. As a reminder to the board, this is going to be an entire meeting discussion. Our actions or our options will be discussed in item 7, at which time, as a heads up to our legal counsel, I will be asking about what powers the Board of Optometry has regarding temporary licensure, et cetera, via regulation, et cetera. And if we don't have the powers to do whatever we want to do, who does have the power? Is it the governor? Is it the Department of Consumer Affairs? Is it the legislature? So that discussion will happen at item 7. Also, to the speakers, if you have time and you can listen in on that discussion, if you can come back and listen on the discussion and offer your ideas as part of that discussion, that would be helpful. And then finally, the remarks that all of you gave are very interesting and very informative. If you have any a writing summarizing your remarks, particularly the numbers that you provided to us, I think we welcome them into our record because we can use that as support for whatever action we want to take. All right. Let me shut up and open the floor up to any board members for comments or questions. Anyone?
Yeah, this is Jeff Garcia. I do have a couple of questions. The first one will be to Shara. Do we know what the other state boards are doing at this time?
We do, Dr. Garcia, and part of number 4, the presentation from OPES, will run through the waivers that have been provided and the actions that other boards have taken.
Thank you.
I thought I saw another hand raised. Okay, David. Actually, following up on Dr. Garcia's question, I know that what other states are doing is the topic for a later agenda item. I am wondering, however, whether the deans also know the answer to that question, because the deans may have information different from what OPES has. So I'd like to hear what the deans know.
And what are the other colleges doing would be the follow-on question for the deans.
Yeah.
And if I just may, really quickly, Mr. President, I agree completely. What will be covered in item 4 will be the actions of other state boards. I believe that was the specific question from Dr. Garcia, unless I misunderstood. So I think we definitely do want to lean on our deans. We also have within our attendee list, Dr. Jill Bryant, who is the executive director of MBEO, who may have some information on the ways in which other states have attacked this challenge as well.
So deans, do any of the deans wish to comment on Dr. Garcia's questions?
I can comment. ASCO received this a document from ARBO, from ARBO's executive, listing their current state of knowledge for every state. My understanding is that our state, that your state board, our state board received the same document. So I think we're all working off the same document, and it's very up to date. And I don't think there's anything to add to ARBO's document.
All right, thank you. Jeff, I think you also asked what are other schools doing? I guess in other states. Is that right, Dr. Garcia?
That's correct, because our situation is not unique here in California. So what are the other states doing to the other colleges and the other states doing to mitigate the risk of testing?
I can speak of 3 examples from Michigan, from Alabama, and from Oklahoma. And each of those states have an excellent partnership with their schools and colleges of optometry in those states. So in the state of Michigan, they did allow a pathway for temporary licensure. They made that decision in the early phase of the pandemic and concluded that at the end of July. But they are currently reviewing whether that would be another thing to extend. So they recognized essentially the risk and the dangers and did create an alternative pathway. The state of Alabama has longstanding had an opportunity for temporary licensure in between the time of graduation and the time of completing the state licensure requirements. So they've been more flexible about the duration of that temporary licensure, is my understanding from University of Alabama, Birmingham School of Optometry. And in Oklahoma, we'll hear perhaps a little bit more detail about that process. But the university in Tahlequah in Oklahoma works very, very closely with the state board and even provides some additional assessments, communications, et cetera, to support the licensure decision making. So those are 3 good examples of the partnership that the schools and colleges have formed with some of the state boards.
Okay.
Follow so
Garcia.
I believe 23 schools in the country now. Maybe I'm off a little bit, but so there's the other 20 schools must be doing something, or are they not? Do we know, Dr. Hoppy?
I think we're all talking about different strategies and different opportunities. Perhaps Dr. Flanagan would like to share a little bit more from the Association of Schools and Colleges of Optometry as well, because this is definitely on the forefront of all of our minds as to how to approach this. So I know there's been a lot of conversations across the country.
Yeah, there certainly are. It's not clear to me what you're actually asking. I mean, obviously the schools don't have the power to grant licensure. So it really, Dr. Hoppy addressed a few specific examples of where schools and their home states are working closely together. But of course, all the schools have concerns about their students. But I can't, I'm uncertain how to answer your question about what are the schools doing about it, other than advocacy like we're doing. We're speaking on behalf of our students to try and make sure that they are welcomed into the workforce and that we at least plan for the emergencies that are happening and may well still happen. If there was something specific that you were wanting about the schools, I'd be very happy to answer. So.
I understand that the schools cannot license their graduates, but I was curious if the associations you have with the other schools through ASCO, if you were able to find out of best practices for that particular state, or if there was something that some information that we could glean off of what other people are doing, other schools are doing, that could help us here.
Mm-hmm. I mean, the vast majority are in the same situation we're in that, the vast majority of state boards still require national boards and do not yet have an emergency legislation. But there are the group that are listed, and I believe we'll discuss in more detail, that already do have, the state boards do have that ability to be able to grant temporary or emergency license.
Thank you. Dr. Tresky?
Just a question following up on Christine Schultz's comment regarding the schools attesting to the competency of their recent graduates. I know that issue was something along those lines was mentioned at our last board meeting, and there was a concern, I believe, from Dean Flanagan that could put the universities in an untenable position in the event that there was some type of a liability claim. Is that a potential issue that the deans see if there was an attestation to competency from each of the schools?
If I could answer that, it was true. We had some discussion that led to me saying that that there could be issues of liability with the schools, but it was a different question. So, from the point of view of, do the schools feel that at graduation the outcome clinical competencies are well documented and proven? Absolutely. And there's no liability issues around that. There's none. The liability, what I was asked, and I believe by you, David, was could we consider some system whereby the students graduating could work, but would be under the supervision of the schools for an additional year? That's where I imagine that the lawyers might have an opinion about us accepting liability for people being in private practice, and that could be difficult. We may have to explore everything, but it's quite a different question. In terms of outcome clinical competence, we have absolute confidence in our students and their outcome and their clinical abilities on graduation, and I do not believe that would be a liability issue of any kind.
Fantastic. Yeah, you're correct. That was my question last time. Now I remember. So, no, that's a big help. Thank you, Dr. Flanagan.
Thank you.
Any comments or questions from any other board members? If not, I have a couple. So, in any of the schemes in the other states where they do have a path toward temporary licensure, is there an additional requirement under those regimes that the temporarily licensed optometrists work under the supervision of a licensed optometrist? Is there anything like that, like an apprenticeship or something similar? I think other professions might have that or may have had it in the past.
I can share that we are aware in the state of North Carolina, some regulations recently adopted for provisional licensure does require supervision by a licensed doctor of optometry. In some of the other states, there are circumstances where there may be a process for attaining licensure with advanced scope of practice, particularly use of lasers, where there's almost an apprenticeship style for a small number of cases or a duration period of time on that pathway for licensure in those states.
My next question, I've read through your application for the waiver to the Department of Consumer Affairs and read their response, and I was also informed that a number of other professional schools outside of optometry asked for a similar waiver, and the response was the same as the optometry schools responded. It seems like, and I'm just reading between the lines, that the official response is that the waiver not be granted partially because that the optometrists are not involved in the direct care or response to patients who have COVID. I think I saw that nurses were given a bit of a waiver on some of the requirements. I expect because they're out there serving patients with COVID or assisting in the response to COVID. What if that is the issue for the those powers that be? What would your response be, or how would you address that concern?
Mr. President, if I could for just a moment, we will go into more detail during the OPS presentation, but just to clarify that nursing was not given a waiver of its testing requirements.
Okay. All right. Well,
I do have an answer, though, also, by the way. This is Christine Schultz with California Optometric Association.
please, Christine.
So I think one of the things that I think it's wrong to say optometrists are not actually providing care to COVID patients. Not only are they providing care to COVID patients, they're keeping patients out of the emergency room. Optometry, according to the American Optometric Association, optometry diverted more than 200,000 during COVID-19 March surge. And so I think it's important. I mean, the DCA may not be aware of how involved optometry is, but they are very much involved in providing patient care and to preventing numerous people in the emergency rooms.
If I may add, some of the research that is now coming out from other countries has also indicated the very high prevalence of ocular signs and symptoms, particularly in the pediatric population that's infected with the coronavirus. So we do know that conjunctivitis, eye irritation, uveitis, iritis, all are part of the manifestation of the coronavirus response. In addition, I can share that I currently have students out on their fourth year externships who are participating in symptom screening, who are doing temperature checks at their healthcare facilities on the front lines as part of an interprofessional approach to battling the virus. And we're hoping, as the regulation is adopted for immunizations in the state of California, that perhaps doctors of optometry can assist maybe initially with the flu vaccine to avoid the twindemic, but eventually, perhaps as the coronavirus vaccine is prepared, that we can also be approved to deliver vaccinations. So I think that as part of an interprofessional approach, where it's all hands on deck, and we heard the quote before, we're at war with this virus, there's a vitally important role for our doctors of optometry on those front lines. And we are seeing it in our schools and colleges, in our clinics, in our affiliated network currently.
Oops. I'm sorry. Will I unmute? Moderator, would you open up the floor for
public comment?
Yes, open up the floor for public comment, please.
All right. This is the moderator, and at the direction of the board, I have opened the Q&A panel. If you would like to make a public comment, please click on the Q&A icon located at the bottom of your screen and type "I would like to make a comment" in the ask field and send to all panelists. I will take all comments in the order they are received. You will be provided a 2-minute time frame to make your public comment and a 10-second warning. I do have an individual identified as Robert Summer. Your microphone has been unmuted.
Yeah, hi, this is Robert Sumner with the Assembly Committee on Business Professions. Just to briefly say that Assemblymember Lowe would like to echo the urgency of the issue related to the Part 3 exam and the various implications of having to travel to North Carolina to take that during the COVID pandemic. It's an issue that was probably worthy of examination during the board's next sunset review prior to the health crisis, but obviously this associated issues. So again, just generally, the chair wished to kind of lend whatever voice he could on behalf of COA and the schools, and then also commit the committee's resources to anything that could be useful on the legislative front as solutions are explored. Thank you very much.
Thank you. Ms. Schultz, did you tell me there was someone else that wanted to speak on this item? Was I mistaken?
Yes, we had Dr. Cockrell from the Oklahoma, and he's saying that he can't activate the button for questions. So he's having some technical difficulties, looks like.
All right.
This is the moderator. I can manually unmute him. Would you like me to do so?
Yes, please.
Mr. Cockrell, you have been unmuted. Mr. Cockrell, you are unmuted.
Well, as we're trying to get him on the line, Madam Moderator, do we have any other members who are seeking public comment?
I have not received any additional requests at this time.
Okay, so why don't we work to get Dr. Cockrell on?
Can you hear me now?
Yes.
Oh, perfect. Thank you very much. This is Dr. David Cockrell, and I am a practicing optometrist. I'm also a state board member in Oklahoma. And as you all are dealing with this issue now, we dealt with it this past year with multiple situations. We had students who were unable to complete Part 3, who were seeking license. We also, through the Oklahoma College of Optometry, have about 30 residents who annually take our board to do residencies either at our local VAs here in Oklahoma or through the Oklahoma College of Optometry. We looked at the qualifications of the individual applicants, and then we tried to find a way to create a situation where they could actually practice. As we looked at it, we leaned upon the information we got from ASCO and from the schools and colleges of optometry to determine whether or not we thought these applicants were competent. As you all know, the state board's job is not to look after optometrists, is to protect the safety of the public. And in reviewing that, we found the same thing that the three deans have just attested to, that our schools are really where the rigorous education takes place, but more than that, the rigorous testing takes place. And we ask ourselves, was there truly a reason that we should keep someone from moving into practice because they were unable to access a board due to no fault of their own? At the same time, just as been discussed, we had two students, one with MS, one with another problem, that had they been able to travel to North Carolina, would not have been safe for them to do so, but it was not going to impair their ability to practice. Based upon that, our state has the authority to waive the requirement of passage of the national boards. And so in this particular case, we did a formal review, formal motion to waive requirement of national board passage during the pandemic. We could foresee that very likely we could have the same exact problem next year, or I'm sorry, in 2021. And so we chose to try to get ahead of that issue. It did, I think, really create a huge sense of relief for the residents. Some of them were not going to be able to start their VA residencies were they unable to be licensed. And we had two traveling, actually two traveled from Arizona and two from California that were going to be in VAs there to be licensed in Oklahoma, because as you probably know, to practice in a VA, you need a license from someplace. It doesn't really matter what the state is. So they were able to come to our state and be licensed in Oklahoma and meet our other requirements, which in our particular case, they're still required to pass our state law. And just because a little bit of the unique nature of Oklahoma, they had to pass our laser certification classes. But beyond that, once they did that, we took graduation, a demonstration of graduation and successful completion of College of Optometry that settled our state board's mind that these individuals were safe to practice. As an FYI, we had students from 17 different schools and colleges of optometry take our state board this year. I'm sure California has probably someone from everyone. I don't want to run on, so I'm happy to answer any questions.
Board members, are there any questions for Dr. Cockrell?
This is Jeff Garcia. Dr. Cockrell, did you say that you waived all three parts of NBEO or just part three?
We actually waived all three parts. We had one applicant who had missed part one by 1 point and could not retake the test. And so that particular applicant, we created a situation where we gave them a provisional licensure, and they cannot complete a full licensure until they actually successfully pass that. So they have a provisional licensure for this year, and that's the one we did it for.
Any other questions?
Mr. President, if I may, Dr. Cockrell, how many optometrists does your state oversee currently, or how many graduated class for licensure?
Our state has a little over 700 licensees, but we have an average about 50 students take our board on an average year. This year it was a little bit more than that. I think it was 58. We give our state board examination only one time per year. So in that particular case, if they don't do it this year, if they had not been able to do it this July, it would have entailed a year wait. Our concern also with some of the things that have been by the deans. We have students with several $100,000 worth of debt that were intending to practice in Oklahoma that would not have been able to do so for an additional year. I know that Kentucky, I talked to their state board yesterday, they did and formally vote in July. I don't know if it's in your packet or not, to waive part 3 as well this year.
Any other questions by members of the board? If not, I have a couple questions, Dr. Cockrell, if you don't mind.
Yes, sir.
So you say we waived. Was the board that issued was the board empowered for the waiver, or was the waiver done by the legislature, the governor's office, some other body in your state, in Oklahoma?
Our state board has the regulatory authority to make the waiver, so our state board did it.
Okay, thank you. And then, as they did their waiver, or as they were deciding on the waiver, did they examine the curricula of the Oklahoma schools related to what's tested on the on the MBO, and then after reviewing that curriculum, decided, okay, this is good enough for a temporary licensure? Was there a school by school examination, or how did they go about making that decision that the graduation from the schools was enough?
That's a great question. We did two things, actually three. We did obviously request information from the Oklahoma College of Optometry, because we have the majority of people who typically take our board are from Oklahoma, but we also requested information from ASCO itself so we could compare the curriculums from the other schools to the Oklahoma College of Optometry curriculum. And as we learned, the curriculums they're not exact mirror images, but they're virtually exact in every one of the clinical areas that involve direct patient care. And so we looked at those. We looked at the Oklahoma College of Optometry. We also looked at the training programs were mirror images in terms of the requirements for the students when they're overseen by clinic faculty at their schools and on their externship sites. Those were the similar or the same as far as we were able to ascertain from ASCO's information. So we looked at both, and because we knew, just like every year, we would have students from any number of potential schools.
Okay.
One other thing we did do, the individuals who were granted licensure this year, with the exception of the one, were all granted full permanent licensures. So we didn't require them to go back and retake part 3 at some future date. We had no idea when it would be. And we knew the farther away it got, the more stress was going to be created in their life.
Sure.
So.
Okay, that's interesting. And so the waiver is not just for graduates of Oklahoma schools, but for graduates of any school in the country, or any accredited school in the country?
It is for any. It's exactly right. It's for anyone who took our licensure examination this year, graduated from an accredited college of optometry in the United States and Canada. Any of the ASCO schools, they all fit within that.
Okay.
We tried. I'm sorry to interrupt you. We tried to create what we believe was an equitable opportunity for everyone. And we certainly didn't want to do something just for some student who happened to have gone to school at Oklahoma College of Optometry. Again, because we have, for Oklahoma, a small state, such a significant number of residents. And some of them, again, like I said, weren't able to take part 3.
Yeah. This will be a question for legal counsel later on in our discussion, and as to whether or not the state or this board have the power to grant a temporary license or a waiver, whether we could limit that just to graduates of California schools, or whether we would have to, if we were to take that, if the decision maker were to take that step, whether that step would have to be offered to any graduate of a school, and then not just limited to California schools. You don't have to answer that question now, Rebecca. It's a question I'm just posing to you that we need to think about and know the answer before we take any final action. All right. Any further questions by members of the board? Any further comments from members of the public? I'm sorry, David. Jeff?
Yeah, Mark, I have one more question for Dr. Cockrell. So,
Sure.
Oklahoma, tradition in a typical year, are parts 1, 2, and 3 of MBO sufficient to get licensed, or is there a separate state exam as well?
We do have state examinations. Everyone has to pass a separate law examination. And then also our state requires everyone to be certified in lasers. So we only have one level of licensure. So someone coming from another school and college of optometry that wasn't specifically trained in it has to go through training before they actually can sit for our board of examination, which we offer. We offer a class for that through the Oklahoma College of Optometry prior to our examination.
So just to follow on, so the class is specific to lasers and the testing is specific to lasers only?
Yes, that's correct.
Any other questions by members of the board? any comments, any additional comments by our panelists? Of course, the panelists will have an opportunity to speak as we go through the agenda on the other items, and we appreciate your input. Just as a marker here for myself, I know I've been asking a lot about competency, but at least in my own mind, I'm not acting or working toward a permanent waiver of the NBEO exam. So that means to me that, yes, we don't want an incompetent doctor out there, but it's not like we're saying you don't have to take the NBEO ever again. You have to take it eventually anyway. So we're just talking about, are they competent for this temporary period, so we can actually test permanent competency through these exams. So it's just kind of a measure for my own mind. All right.
Mr. President, if I may.
Yes.
It is Shara. Your comment goes back actually directly to a comment that was made about North Carolina. So in North Carolina Standing Authority, their current statutes, they maintain a statute specific to externship. So this isn't an action that's been taken during the pandemic. They allow an optometrist who is awaiting testing to work under the supervision of a licensed optometrist. They are required to have that optometrist physically present during each examination. And it is only for the when waiting for those examination results.
Thank you. Something to keep in mind. All right. Without objection, can we move on to item 4, the presentation of the Office of Professional Examination Services? All right. Let's move on to that without objection. And Deans and Ms. Schultz, thank you very, very much. We welcome your comments and questions as we go on to the other items related to this topic. So, Shara, do we have the representative from OPES available?
Yes, we do. We'll be hearing from both Dr. Heidi Linzer and Dr. Tracy Montez. They have been elevated to panelists.
This is Heidi. Can you hear me?
I can hear you.
Okay. Good afternoon.
Actually, before we start, board members, do we need a break or shall we just continue? All right, let's continue.
I have a PowerPoint that should be loaded.
This is the moderator I apologize. This is the moderator. Unfortunately, I was not provided a PowerPoint. What I can do, Heidi, is pass you the presenter role and you can share your screen in the PowerPoint.
It's in the packet for the board members. So I don't think I need to do that. It's okay.
Okay.
Just go without it. That's right. Okay, this is Heidi Linzer. I'm the chief of the Office of Professional Examination Services. And in your packet it's very brief, just 3 PowerPoints, and some of it has already been covered. So I just provided a description of the different examinations that are required for optometry licensure, which you all are, I'm pretty sure, well aware. There's the Part 1 examination, and this was discussed by the deans earlier. So Part 1 usually taken during the 3rd year, MBO Part 2 taken during the 4th year, and then the Part 3, which is the subject of the concern right now, because it's only offered in North Carolina. And just to give you some background of why OPS is in this discussion is that we are consulting division of Department of Consumer Affairs. We work with the various boards and bureaus in DCA to make sure that their licenses are valid and legally defensible. OPS is mandated by Business and Professions Code 139 that says that all examinations that are used for licensure in California must be based on an occupational analysis, which is a detailed study of the profession. The occupational analysis is a legally defensible method to determine the content of the examination to ensure that it measures safe and competent entry-level practice. And be aware that any alternative licensure process would need to meet the requirements of 139 and be validated by OPES. As part of BMP 139, OPS was mandated to develop a policy 1802, licensure validation policy, which requires reviews of all national examinations to ensure that they meet testing industry standards and guidelines, and to make sure that the examination content is appropriate for California. So before COVID-19, OPS was working with the Optometry Board to complete this national review process for the NBEO examinations. And we completed that review, and we are scheduled to talk about that review at the future board meeting. But as it's relevant at this point, I will go ahead and say that we did the review and determined that the NBEO examinations are measured entry-level content that is necessary for licensure in California. And we did mention in our review that having the Part 3 only in one location could be an accessibility issue for candidates, and that NBEO should consider offering Part 3 at multiple locations. We are sensitive to the current situation of applicants having to fly somewhere to become licensed, and it has been a consideration of NBEO to have one location in order to have a standardized examination. So we will discuss that at a future meeting. However, the examinations that are required for licensure, not only so do they meet 139 according to OPES's evaluation, but the examinations are listed specifically in your regulations in 1531 and in 1523 and other codes that are in your packet. So from a psychometric perspective, these exams are legally mandated, and they ensure that the board is in compliance with BMP 139. So if the board was to try to consider alternative licensure processes, I said, those would need to also meet BMP 139 requirements. And Tracy is going to talk about what other boards who are in a similar situation as your board, who have a practical examination that has become difficult to administer or difficult for candidates to get to due to COVID-19.
Thank you, Heidi. I'm assuming I'm heard. Yes, thank you.
Yes.
I am Tracy Montez, and I'm the Division Chief of Programs and Policy Review with the Department of Consumer Affairs. I'm also the former Chief of the Office of Professional Examination Services. I am a trained psychometrician, so I like to work with Heidi on these presentations to give you additional information with my involvement with the executive team. And I'm actually going to talk first about the waiver. So I'm going to jump to item D. And as of yesterday, the department had issued 62 waivers. Many of those have been extensions of initial waivers that were issued early on in the pandemic. And I want want you all to be very clear that the department recognizes that this is an extreme situation and that it is hitting our entities, our programs extremely hard. The boards themselves, boards and bureaus, the students, candidates for licensure, schools, training programs, it has certainly challenged us all. And we are all working together to try and find the best solutions. Sometimes they're not popular solutions, but they are extremely sensitive to what is happening. But it's also very important for everyone to understand that although the director has been given authority to issue waivers, she does have to work within the parameters of laws and regulations that are established. And so that's one of the pieces of information that is not always clear to everyone, that she does not have control to simply waive every piece of statute or, again, law or regulation. So with regard to the waivers that have been issued, if you go on to DCA's homepage, there is a link that will take you to all 62 waivers that you can check, and you will see that they range from extending continuing education, times, license renewals, also in-person supervision. The only really examination requirement that has been waived is for interns, and that is through the Board of Behavioral Sciences. Their associates, or interns as they're known, have to take the California and Law and Ethics examination annually until they become licensed. And so they were able to extend this examination requirement, but they are still required to take the exam. They are not licensed as marriage family therapists or clinical social workers or professional counselors. Again, they are associates. So there hasn't been any exam waiver per se to actually become licensed, even though there have been 62 waivers issued. But again, the director does meet with her team and review each of these waiver requests very carefully. They do research. They consider how the laws and regulations are written when they do render their decision. So again, those are the types of waivers, just again, some examples. But if you, again, go to the homepage, you can click on a link and it will show all 62 waivers. With regard to other boards, Heidi mentioned to you that we have some boards that have had some challenges there. I'm going to again share some examples with you. We have the Dental Board of California. They're registered dental assistant in extended functions. It's a relatively small program, but they are required to have a clinical exam that is patient-based, and they are having difficulties obtaining sites with the schools. The schools are not doing testing right now, so it is prohibiting the candidates from advancing. Now, many of them are already registered dental assistants. They're looking for a higher level of certification. So fortunately for many of them, they're still able to continue to work. However, they cannot advance. So at this time, the board is looking for options, but they are essentially cannot move forward until they can locate some sites. The colleges are willing to work with them. We also have the hearing aid dispenser. These individuals have typically had a clinical or practical exam about 4 times a year where we bring in large groups. They have had to revise their process, and what they're doing is smaller exam administrations implementing health and safety procedures. So that's another example. Another board that we recently met with and spoke to the issue is the Dental Hygiene Board. Again, registered dental hygienists are required to take a clinical exam, and we are finding that they are having difficulty recruiting patients organizations to participate. They do work with national associations. There's a variety of, they're actually more like regional associations, and those regionals are allowing non-patient versus patient, but it is still creating some difficulties for the dental hygienist and how the requirements in their law are written. So the good news for most of our programs is that although there were delays in taking their written exams via computer-based testing, most of those sites have opened up. In fact, our department's vendor PSI is now at full capacity. And so we do see a trend where those exams offered in that modality are opening up. Candidates are being able to examine. It's where we have these practical or clinical exams that we are having, again, some challenges. But we're trying to work with the boards that we can. As Heidi has mentioned, if alternatives or options become available, we work with the board to make sure that it's valid and reliable and fair. And again, look for ways to create opportunities. And we know that some of these boards have looked for waivers, but again, they have not been approved by the director. But again, we're continuing to look for other avenues so that they can meet their laws and regulations. Before I end my part of the presentation, I'd like to just briefly comment on a few things that I heard, because again, a lot of really great points were made. But as a representative from the department, again, I want to make sure that the board always keeps in mind that the mission is to protect consumers or patients or clients. That's the mission. Of course, we always want to make sure that our exams are fair and valid, which means that we don't want to have any artificial barriers to licensure. So I really think it is important to look for alternative ways to test, and especially a single location can be perceived as a barrier to licensure. But certainly at some point, the board may want to step back and go, are our exams needed? And maybe what kind of exam? Because I've heard a lot of information about how well the schools are doing, how high the pass rates are. So that tells me what your regulatory exam. Certainly, as a state board, it's important to have a final hurdle in the process to catch those individuals who perhaps are not ready for entry-level practice, because there always are a few that are not quite there yet. So really thinking about how many exams you need, what kinds of exams they need to be, national, state, and as you look at alternatives, how does that address portability? If you just had a state exam versus a national, or if you have a temporary. Again, really thinking about, and again, long term, maybe after you address this piece, but what are those exams you need? Written, clinical, what's the best way to assess those entry-level skills? Because your schools sound like they're doing, or your colleges are doing an excellent job at teaching the full range of skills and knowledge to practice. But really, your licensing exam only needs to measure those critical knowledge and skills for entry into the profession. So really stepping back and looking at that. So again, Heidi has reminded you again about the various exams your board uses, how they need to meet Business and Professions Code Section 139, which is based on those national testing standards that NBEO uses, and that any modifications or adaptations should be vetted through OPS, and that we do have a number of boards that have some challenges, as your board does. And are looking at alternate ways. But then again, with regard to DCA's waivers, they're very empathetic to the situation for students and candidates, but they are bound by the laws and regulations. So thank you. I'd be happy to entertain, or we'd be happy to entertain any questions you may have.
Board members, do you have any questions for our two panelists? I heard a grunt someplace out there.
This is Dr. Garcia.
Go ahead, Jeff, Dr. Garcia.
Yeah, this question is for Tracy. Tracy, being with the DCA, do you know much about the pre-licensed categories? I know there's pre-licensed psychologists, pre-licensed psych techs that are able to practice in California prior to licensure. I believe the psychologists have 5 years. Is that something that you deal with at all in those other health categories?
We do work with the Board of Psychology and the Board of Behavioral Sciences. I can't speak to the specifics, but they do have everything outlined in their regulations about, the various requirements that must be met. I will say that we were part of the Board of Behavioral Sciences changing their California law and exams process. We think it was just an excellent modification. Typically, to sit for licensure, a candidate would have to take 2 exams, a law exam and then a California exam. Then they started going to national exams. So that added a 3rd exam, which we thought was very laborious for the candidate. So the suggestion was made to move the law and ethics exam earlier at the time that they would go out and do their supervised hours, because really that's when they need to know the law and really where there's the potential for harm, even though they're supervised. And so we did assist the board in that decision-making process. But with regard to the actual specifics of what is required, I would have to pull up the regulations for each of their programs. But we do like it because we think, again, it gives the students opportunities to get through the various hurdles at a reasonable time. I will say I personally am not a huge supporter of having licensing exams too early in the educational process, because to me it becomes more of a final exam versus a high stakes licensing exam. But certainly law and ethics exams or other parts may be appropriate for early on. But I'm happy to get you that information if you'd like me to.
Thank you.
Any other questions by board members? I might have a few questions. I'm just getting through 130 Business Profession Codes 139, and skimming through the other quotations of the law in our materials. Where does it say that we can't work with the timing of the exam? I don't think we're saying that you don't have to take the exam, but do we have any flexibility in saying, well, you have to have this exam to be a licensee, but is there a timing restriction as to when that exam is taken?
And this is Tracy. I would defer that to your legal counsel.
Okay, we can ask that later. Someone there on the panel was discussing the temporary licensure. If we have the authority to create a temporary license, can you recount for me again the steps that would have to be taken in order to create that requirement or to allow for that temporary license?
This is Tracy, and I'll turn it over to Shara shortly, but it depends right now how your regulations are written. If there is a mechanism to receive a temporary license without taking Part 3, that may already be in your regulations. So there could be an opportunity for candidates to get licensed, not doing the full spectrum of skills, and then take Part 3 at a later date. Shara, I'll let you correct me or expand as needed.
So I'll have Rebecca back me up here too. Our reading of the law and through our discussions, in order to be licensed, one must have completed satisfactorily parts 1, 2, 3, and the California Law and Regulations exam. It does not appear that we have the ability to issue a license of a temporary or non-temporary nature if those four pieces have not been completed.
So what you're saying is under either the law or our regulations or both, there's no such thing as a temporary exam. Excuse me, a temporary license, that once you're licensed, you're licensed.
That is correct. Neither our statutes don't give us the flexibility to create that. And then, of course, then there aren't regulations if there isn't a statute to which regulations can be tied.
Okay, and statutes are passed by the legislature, not by us.
Correct.
So panelists, regarding waivers of some of these requirements, who has the power to grant those waivers again?
The director has the power to grant waivers.
Okay.
And
but not the Board of Optometry.
Correct. The governor issued the authority to the director under Executive Order N3920.
Okay. And then my last question, maybe this is more for Shara. Do we have any rules about, I heard the word interns practicing, externs practicing. Are there similar pathways for an optometry student, for example, to work in the optometric field without having a license?
That is not a provision that we look for specifically. If you'll give myself and Rebecca a moment to just make sure, I'm not aware of a statute particularly pertaining to internship or externship, but allow us to just check to make sure.
Okay, fine. You don't have to give me the answer right away. I mean, I guess there's something, or maybe we don't regulate that. What if you are in your third year and you want to work in an optometrist office for the summer and do optometrist kind of stuff, as opposed to just mopping floors and filing papers. I would expect there's some way of doing that, but I could be wrong. David is shaking his head. Those are my questions. Does anyone else on the board have any further comment or questions? David, and then David first, then Lillian, please.
Just a comment based on some texting that I did with Shara earlier in the week. Shara, you had mentioned that it's possible that if a licensee did not take Part 3, they could still be licensed with only a DPA certification. Is that correct?
So that is one of the pathways. That is one of the pathways we discussed, but that in fact is not a possibility. It would require the removal of a particular regulation. This is 1523 Section F.
So it can't. That's not a doable thing.
That is something that could be requested by waiver. I'm not sure, again, as Dr. Montes mentioned, that is the way in which, not simply because, I apologize, there was another sort of example for, or reasoning for, the lack of waivers that have come out from the department. I've heard it very clearly communicated from the director that if we begin to remove requirements for licensure, if we say that this is required to be safe among consumers, then there's, of course, then that brings into question after that point, why will we need to reinstate that requirement? There is in item 6, we'll walk you through. Dr. Turetsky and the rest of the board members will walk you through how we looked at that, but came to a limited ability to affect that kind of change, and also a limited ability to create a system that really provides accountability as well if we were to remove that regulation.
One more quick, just a comment, and I know the professional members of the board know this, but for the public members, it seems like of somewhere, somehow, issuing a full, complete license. If somebody does have some type of a probationary license, temporary license, something on that order, I would from the research I've done, I would doubt that they would be able to be part of any insurance panel, whether it's a vision panel or a health insurance panel. They probably couldn't get on Medi-Cal, and they probably couldn't get on Medicare. So we'd be limiting these temporary licensees to pretty much doing eye examinations on fee-for-service cash-only patients, and would greatly reduce their ability to see a wide variety of patients that are covered under alternate methods of payment. So whatever we do figure out on this, if we can come up with anything, that's just something to be aware of. We might somehow figure out to give folks a license that's relatively worthless in a lot of instances.
So I have Dr. Wang and then Dr. McIntyre.
The other issue is if these people don't have a full license, they're not going to be able to get their own liability and malpractice insurance. So who's going to insure them? They can't work. They simply can't. Just
Dr.
adding
Wang?
to the difficulty.
Oh no, I just wanted to address your issue where you had asked if people could work in offices if they didn't have licenses. Let's say if they're a second year or third year student, and you can, you're a tech, but it's always under the liability of the doctor that you're working for. So again, if we have students who are going to be working under other doctors, the issue is getting liability insurance and then being able to get on any panels. So if they're restricted from getting on panels, if they're restricted from getting malpractice insurance, then they're effectively a tech, and their hireability will be extremely limited. So it's either it has to be a license so that they can actually work until they can take Part 3 of NBEO.
Any other comments by members of the board? Do we have any comments by members of the public?
This is the moderator, and at the direction of the board, I have opened the Q&A panel. If you would like to make a comment, please submit. I would like to make a comment in the Ask field and send to all panelists. I will take all comments in the order they are received. An individual identified as Masha Masudi, your microphone is unmuted.
Hi, I guess you guys can hear me. My name's Massa. I'm a fourth-year optometry student at Berkeley Optometry, actually. And I want to first thank you for opening up the conversation and allowing me to be here. I wasn't sure at what point would be best to speak up. I think topic 5 that was moved up earlier was pretty powerful. And I wanted to say something later on topic 7 too, but I wanted to thank Dr. Wang just right now for exactly what she said, because as a fourth-year extern student, we do go to different places, and we even leave California for some of our externships. And in those cases, we are working under the liability of another optometrist, and sometimes it's an optometrist completely out of our state. So they are making the leaps to guide us and allow us to learn under them and see patients. But if this were to continue after graduation, where yes, learning shall be a lifetime activity, but if it should continue that way after graduation and we're trying to get jobs in California and we're working under another optometrist, there's an implication for them too. I mean, if this becomes a long-term thing, are their insurance rates going to go up? Is it going to be common knowledge that they have hired 3 new, call it quasi-externs, quasi-graduate doctors to work under them, and now they have to sign off on all these other charts where they're not actually seeing those patients in their entirety? So it's could be impacting the other ODs in California that you have already licensed. And I think that should also be a consideration for how will the entire optometric community move forward. And not just us, but I mean us because it's personal. But if it's okay, I'd like to speak up again a little bit later around alternative ideas. And thank you for your time for now.
Thank you. Thank you for that input. And you will have the opportunity to speak on other items, as many items as you wish, actually. Any other members of the public?
We do. Our next individual is identified as Elizabeth Hoppy. Your microphone has been unmuted.
Thank you. I wanted to follow up on some of the discussion regarding the regulations in North Carolina. I believe the use of the phrase extern is a little bit different in the way that their legislation is written, or excuse me, their regulation is written. So with your permission, I would like to read directly from the North Carolina website that shares a little bit more of the information. It says, in the absence of a license to practice optometry in North Carolina by either a new graduate or practitioner licensed in another state who wishes to apply for a North Carolina license, there is no statutory provision that allows an individual to practice except at the direct and under the supervision of a licensed optometrist or physician. I'm going to skip ahead and say the board will consider on a case-by-case basis and under certain circumstances, allowing optometrists holding a degree Doctor of Optometry from a school or college of optometry accredited by the Council on Optometric Education and who have submitted evidence satisfactory to the board that they are eligible to apply for licensure as an optometrist in North Carolina to perform procedures and functions which a duly licensed optometrist may perform in accordance with Article 6, Chapter 9 of the General Statutes of North Carolina. I'm going to skip ahead and say provided that such are performed at the direction and under the supervision of a licensed optometrist. I'm going to skip ahead in the language and say that the word extern comes into play when they say that the unlicensed optometrist hereinafter referred to as an extern. So clarifying the language that the word extern is not for a student in North Carolina. It is for a graduate of an accredited school or college of optometry who is not yet licensed. In interviewing the members of the State Board of North Carolina, we did find out a little bit more information that the period of time can apply for initial taking of the national board, waiting to take the national board, or waiting to retake the national board. The period of provisional licensure is for 6 months duration and can be applied for renewal up to a total of 3 times. So thank you for the opportunity to add more detailed information. Also on that North Carolina board information, they have very detailed description of what supervision consists of, and it's really quite well developed in terms of the policies that they have formed. So thank you. That was my comment I wanted to share.
Thank you, Dean Hoppy. Could you provide that website link to our executive officer so we can see it in black and white? And what you were reading, were they quotations? I know they're from the website, but are they quotations of their regulations or their statute, if you know?
Sorry, I keep accidentally muting myself.
All right.
I believe that this that I'm reading from is under their board policies, so they are regulatory, and I will send that link.
Thank you. Do we have any other members of the public that wish to comment?
We do. An individual identified as Jennifer Coyle, your microphone has been unmuted.
Thank you so much for recognizing me again. I just wanted to, it was wonderful to hear Dr. Montez's presentation. And I wanted to just loop back to something I presented earlier that she brought up, and that was the issue of barriers for the candidate's ability to access the examinations. And the individual that I alluded to in my presentation actually has a identified ADA issue. And those are the types of barriers that I think have become more complex in this scenario. The other point I wanted to bring up is, it sounds like you're talking about 2 different pathways. One would be a provisional licensure that might be mirrored like what is happening in North Carolina under the supervision of another optometrist. But I do really appreciate the conversation about providing temporary licensure and whether or not the new licensees, whether it's temporary or permanent, would be able to access malpractice insurance or be able to access panels. And, in my mind, and maybe there's, there are always things I don't know, but could it be viewed as a temporary license that would have an expiration date, just like any other license that we have in our state? It expires if you don't do this, this, and this, whether it's bring in your CE certificates or any other requirements. And could it be a temporary license? So they are licensed for a period of time, but the only way it could be renewed is if they demonstrate that they've passed the national board exams within whatever you consider to be a safe amount of time. Thank you.
Thank you.
Yeah, this is Dr. Garcia. This question is for the deans. You brought up a point. So do you have a sense of what your students feel about getting a waiver and getting a provisional license, but having to pass and take NBO at some future time? How many of your students would rather postpone taking the NBO and not having to take it during the pandemic versus just going ahead and taking it now and not delay that? Part 3.
This is Jenny Coyle. I'd be happy to be the first one to attempt to answer that. I'll be honest, I have not polled them with that particular question. At this point, the class of 2021, I think they're beyond hope. And that type of question, I think, would give them hope to follow through with. But I'd be happy to follow up with that if that's important to your deliberations. I will say, at this point, the students have registered for the exam because in their mind, they don't have another option. But the data that Ms. Schultz presented from the COA's poll suggests that the students are afraid. And those are the types of comments that I've received directly from students, that I can't believe I have to get on an airplane right now in the middle of this pandemic and fly through busier airports to take this exam. So my gut instinct is that we will have students pursue a temporary or provisional license.
If I may chime in, I think the best predictor of future behavior is the predictor of past behavior. And I think we heard loud and clear from the testimony of Dr. Cockrell that those students who graduated and then elected to pursue residency education, who found themselves in the situation that they absolutely must have a license in order to pursue their dream of postgraduate residency education, the only pathway that was available to them was to become licensed in a state other than where their residency occurred. So as you heard from Dr. Cockrell, the state of Oklahoma was inundated with applications because that was deemed a more viable and more appealing pathway to licensure, even though you also heard from him that it did require additional work, additional study, additional testing specific for the laser certification. So I think the fact that we saw so many graduates from 2020 going down that pathway is a really strong indicator that if there were a pathway available to the graduates in 2021, that they would also be very likely to find that very desirable, so that it would be less risk for them and their families.
And John Flanagan here. Can you hear me? Yes, good, thank you. Again, I haven't polled directly the Berkeley students, but I'd be very surprised if there wasn't a lot of them who would take the opportunity of a temporary license if it was offered. Yeah.
Did you say okay, Mark?
Yes.
Question for Shara and for Rebecca. If we can somehow figure something out that that can meet all the hurdles that we have to jump through and allow folks to begin their career and actually start to practice. With our responsibility to the consumers of the state as well as the state as a whole, if somebody turns out to have made a clinical boo-boo and it ends up costing a patient their eyesight while they are on this temporary status, what are the legal ramifications for the board and for the state when there are when that lawsuit is filed? I mean, does this, how will it negatively impact us, the DCA, the governor, if the governor's office is the one that approves some type of an alternate licensing scheme? Is that an issue that we should be concerned about?
So obviously it might depend a lot on where this discussion takes you in terms of what that means, in terms of what approval means, or what mechanism allows for someone to be practicing, regardless of how long or how. And then once they are, it's going to be very similar to any other licensee at that point, because presumably we will have gotten to the point in your question by having basically a legal framework. So it would be, like I said, like any other licensee taking action.
So I take that to mean, when you say like any other licensee, it's as if last year we licensed someone pre-COVID, and that person, does the equivalent of leaving a sponge inside the patient, right? It's the same kind of liability, risk, et cetera, that the board, et cetera, would have. The person who is licensee and they made an error, it doesn't make any difference.
Yeah, thanks for clarifying. It's a little hard to answer because it's a little bit in the hypothetical territory, right? Because we haven't really clarified what that means. But presumably, if someone's practicing by one mechanism versus another, if they have a legal authority to practice in any way, then yes, it's similar to as if any other licensee had an issue with meeting the minimum standards, whether license a year ago, 10 years ago, or today.
Thank you. Any other questions or comments by members of the board? Continue, David.
Just because I know this is going to be a potential issue, we go ahead and we figured out some way to do this without taking Part 3, and these folks can get a license. I know that we have at least one, and I believe a couple of applicants who have been unable to get licensed in the state because they have failed Part 3 on several occasions. Could those applicants, these are past graduates, could those applicants now say, hey, I'm going to take advantage of this new way of getting a license in California since I no longer need Part 3? And are we going to be under the requirement to issue them a license if they've met every other standard?
So we're yes, this question kind of presumes a little bit of a jump ahead, but so I think instead it's a useful way of, rather than being able to answer that, right, because we haven't fully fleshed out what that means, how would a person be able to practice without Section 3 at this point, right? So if the discussion takes us there and we kind of understand better procedurally how we might get there, then I think let's use your question as a consideration for what that means broadly. So then we say, okay, if what we're doing here today is looking at two categories of things. One is procedurally, how can we make some alternate option apart from Section 3. So procedurally, again, in this first category, procedurally, we're looking at, whether it's statutory, you had someone from Assemblymember Lowe's office weigh in earlier on their interest in the issue. So whether it's statutory or regulatory, and you have your reg attorney, Danny Rogers, on this call as well, or our DCA representative Tracy Montez spoke to that issue about waivers, right? So just an example of some of the different ways to get where we're going, and that's a lot to navigate. Now let's say we deal with that procedural issue, then we're looking at substantively, with your expertise as a board, what does that mean? What gives you, as Tracy Montez was alluding to, what gives you the comfort or the security that a candidate is going to meet minimum standards for the sake of consumer protection? And that's where you can start looking at things like, okay, well, if we think that, and I'm just throwing out random examples to make the point, but let's say, we think that rather than Section 3, if they're, constantly directly supervised and they, do XYZ else, then we feel comfortable that we don't need their results of their Section 3 of their exam. And then, as you're pointing out, well, that's going to capture more people than just the graduates affected this year with COVID. So what does that mean to us? Is that still sufficient that any candidate, even graduates from 2-3 years ago, that we're comfortable that even if they were failing Section 3, that these other things we're looking at would provide us that security? So that's a little description of why I've mentioned a couple times that in a way it's getting ahead of ourselves, because I think procedurally we have to look at how we can do anything. And then substantively, we want to look at what it is the board wants to achieve with that, which also might drive which pathway you might take.
Thank you.
Hi, this is Tracy. May I make a comment with regard to Rebecca's comments?
Sure.
And so, not to muddy the water more, but as Rebecca was mentioning, the decisions that the board would make from a psychometric perspective, we would want to do an analysis that involves licensees that would provide you with data to make those decisions in terms of what would be feasible for entry-level practitioners to do. That's what makes it a defensible process, is you have your attorney weighing in, you have the board weighing in, and then you have your psychometricians that utilize subject matter experts who are out there in the field, who are somewhat independent, and with data, your occupational analysis that's given us what's important for critical skills, to look at that and say, where can we cut this off from what's being examined and tested? What's reasonable? So again, it adds time and analysis, but that's what protects the board. If you are challenged, we can say, we've done this study, here's our data, this is what our decision is based on.
Thanks for that. Exactly. Thanks.
Oops. Any other comments by board members? Questions? Is the representative from Assemblymember Lowe's office still on the line?
This is the moderator. Let me check for you. It does not appear Mr. Sumner is still online.
Oh, okay. Well, my question to him was, since a lot of the impediments to the board are impediments because the legislature has not granted us authority, wondering whether that office would be willing to introduce legislation to give us more authority, to give us the authority. But we can have that conversation offline. All right, so where are we? Do we have any more discussion about the OP for our OPES panelists? All right, hearing none, I suggest we move on to item 6, unless the board members would like to take a break. Hearing no desire for a break, we will move on. I'm so impressed by my board members. Item 6, discussion of alternatives for the NBAO exam for 2021 graduate licensure applicants. We have a presentation.
So here we want to discuss some of the things and just very clearly talk about the ideas that have been presented and what the particular pathways would be for those to occur. Particularly a waiver or a temporary license. What would have to occur for that change to be enacted, and then some discussion in 7 of what we feel like would be a workable action plan. I wanted to start off, and I appreciate our deans not scooping me. We were, with their help, able to do some informal survey work this week. And I was glad to have Dr. Jeff Garcia and our counsel, Rebecca Bond, take a look, but it is an informal survey. So the first thing we want to do is thank the deans, Dean Hoppy, Dean Flanagan, Dean Carly Coyle, I'm sorry, for giving us an opportunity to get our survey out to the current or potential graduating class of 2021. From the 3 schools, there are approximately 238 potential graduates. We were able to receive email responses from 143 of those graduates. If you, moderator, would be so kind as to give me the ability to share screen, I can run through these.
Shara, you currently do have the presenter role. All you have to do is click down to the bottom and share. Excellent. Thank you very much. So I do want to warn, we did, quickly put this survey together late last week. Again, we're really appreciative of the deans to send this out by email. It is an informal survey. We also did get some feedback from our psychometricians, so it was reviewed quickly by folks within our OPS unit. And I'm going to... There we go. And I apologize that my laptop is the camera and my screen is unfortunately not a camera, so I won't be able to look at all of you at the same time as I'm walking through this. So we sent this email out on Monday to the 238 folks who are anticipated to graduate from our 3 colleges. As I said, we were excited to get a more than 60% response rate. 143 folks gave us some insights. We first looked to see if they are attendees of one of the optometry schools in order to make sure. We then asked if they intended to apply for licensure after graduation. And so I'll run you through the slides, and then we also, thankfully, SurveyMonkey is a great tool, have the numbers to come after this. So you'll see that there are about 10% of the graduating class that does not anticipate. So of our full answered recipient or full answers or responses, 130 intend to apply for licensure in California. 13 do not. Try not to. Our next question was to try to gauge the sensitivity that these graduates have to the COVID threat and the measures that they are taking in order to protect themselves and their families. So you'll see the first is wearing a mask. The second is social distancing. The third is wash and sanitize hands. The fourth is COVID testing. The fifth is to avoid crowds. The sixth is monitor of self-health. And the seventh is avoid travel. And so you can see here on the next slide, our respondents, COVID testing being the last resort that folks are taking at about only 47. And you'll see here, right, that we drop off up here in this corner, answered 28, skipped 15. So that includes the folks, right, who
said that they don't have any intention. The 13 that didn't intend to pursue licensure, that was essentially a quick question. So if you don't intend to apply for licensure in California, we thank you for letting us know that. That gives our licensing team a great opportunity to take a look at our numbers and what our load's going to be. But we want to understand the predicament of those who are planning to pursue licensure within California. Our next question was, have you traveled by airplane in the last 6 months? And you'll see here that, again, the 13 who had the quick question, we had 28, so additional 2 who were, make sure my math is correct, 2 or 3, who did not reply to this question. But you see that 71 out of the 28, 55% of those potential graduates have avoided air travel, or have not, I shouldn't say avoided, have not traveled by airplane in the last 6 months. Our next question is, have you traveled by car a trip of 8 hours or longer in the last 6 months? Pardon me. And you'll see here that 65%, 84 of the 128, have not traveled in a car for a trip of 8 hours or longer. Our next question is, when did you intend to take part 3 of the National Board of Examiners and Optometry exam? We have folks who have completed their test. We have folks who plan to take their test within the next 1 to 3 months, folks who plan to take their test within the next 3 to 6, 6 to 9 months, 9 months or later, and then a contingent that is unsure when they will take the test. We'll dig down into the numbers. And you'll see 21 of those 238 have completed the test. 54 anticipate taking the test before the end of the year. 34 are looking to take within the next 3 to 6 months. And 16 are looking within the next 6 to 9 months. 3 potential applicants are unsure of when they will take the test. Our next question is, have you scheduled your examination date? So not only do they anticipate a timeline within which they will take the test, but they have scheduled a seat for an examination. And so you'll see nearly 94%, 120 of the 128 who have answered have scheduled their examination. Our next question is how folks plan to travel to North Carolina in order to take the NBO Part 3. Preponderance of them are planning to fly by plane, and we'll dig into the numbers here. 123 of the 128. Our next question, I don't want to be used against licensees, but I felt like gave us an opportunity to see how committed licensees might be if they, in fact, were looking for a West Coast location for the MBO Part 3. So we had 64%, or 83 of the potential graduates of the 128 that answered, who said they would be willing to pay a higher examination fee for the convenience of having a West Coast location. Our next question was, if you are willing to pay a higher fee, how much higher would you be willing to pay? Again, I'm not giving NBO the license to increase fees, but just to see the sort of financial aspect of a desire to have a West Coast location. We'll see here that was a 77 of the 82 who answered they were willing to pay a higher fee. We're looking at 50% more they were comfortable with paying. And really not in any way, shape, or form an indication that fees should be any higher. Of course, that should be correlated with the needs of the exam, but an understanding of sort of just how much skin in the game are graduates willing to put in order to have this convenience or to remove this barrier to licensure. And so then our 11th question is, would you pursue partial or temporary optometry licensure to avoid travel to North Carolina during the declared COVID-19 pandemic? And you'll see we have 116 who answered, 27, 15 of those being the folks who had the kill question who are not planning to apply for licensure within California. And so here you'll see that 60% or 70 of the 116 who answered this question would be willing to pursue a partial or temporary optometry licensure to avoid travel. And then, as I alluded to earlier, we have, yeah, that's not any better, pardon me. We have discussed with council our opportunity to provide some sort of provisional license. And as we discussed, there is if we should go back to the statutes, I apologize, item 4, the statutes relevant to exam requirements. And you'll see on page 8 of the packet that there is the California Code of Regulation 1523F. This is the only place where it is a requirement that Part 3 or the clinical skills portion of the National Board of Examiners and Optometry examination be taken to receive the diagnostic licensure. So, of course, we know that as scope, as teaching and understanding and scope expanded within optometry, California followed by adding therapeutic agents, lacrimal dilation, and glaucoma treatment. We originally have a DPA, a diagnostic licensure, that does not include those 3 elements. And it would be possible with the waiver of 1523, as in there isn't anything within statute that requires the clinical skills exam for the diagnostic licensure, that there could be then action by this board to replace or remove 1523F to give us an opportunity to provide that diagnostic licensure if we felt it was necessary, say in a time of a state of emergency. And I think I'll bring you back. Were there any questions that folks, and actually I should probably go back to sharing. Were there any questions that folks wanted to ask about that informal survey?
Question. What is the current fee to take the Part 3 exam? I have no idea what it is.
It is $950 for Part 3 of the examination.
Okay.
And don't forget that also doesn't include, they have to pay for air travel and hotel once they get there. So
correct.
It's an expensive exam to take for them.
Yeah, but they get to travel to North Carolina.
Yeah, I think most of them fly in that night, close to that night they go and they take the exam, and a lot of them leave that same day.
There's real good food in the food in North Carolina is really good.
All right. So do we have any other questions for Shara? I'm trying to get to my gallery view here and futzing around my computer. Oh, here we go. Thank you. Well, as I've listened to all the presentations, I've come up with 5 options, 5 fixes that we can discuss. Each of them have pros and cons and delays. I don't know how we transition from 6 to 7, but maybe they blend together. So why don't I offer my options, unless we want to hear from the public first on Shara's presentation. Moderator, Shara, should we have a discussion now? Hold on. Can you still hear me? Yeah, okay. Why don't I present my 5 options, and board members, please modify them, and we'll certainly get more public comment as we engage in the discussion. So, and I'm not saying that any of these are viable. I'm just saying these are the options that I've heard. Option 1, do nothing. Okay, that's always an option. 2, just for COVID, for someone to take some sort of action, probably a waiver from the DCA, that says that the graduates don't have to take the Part 3 of NBEO. And as we go through these options, I would like input later as to who's the decision maker and what the board can do. 2 kind of sounds like it's a waiver from the DCA. Option 3 is to come up with a solution that says, for the next emergency, the board has the power to grant a suspension of these testing requirements. So the next pandemic, the next, hurricane, whatever, I'm thinking that requires a statutory change or a regulatory change. Option 4 is to create a mechanism where there is a temporary or and have that in place so that we can use it whenever we want. But requiring that temporary license has a time limit and requires passage of the NBEO later. And then my option 5 is to get rid of the NBEO Part 3. However, which way we do it, I think we probably have to do that by statute or by regulation.
That would require a statutory change.
Statutory change, right?
And I think I wanted to just chime in there, but it will definitely be, I think, helpful to go back through and have Rebecca and I comment on what the pathways to that would be so that we understand the timelines.
Yes, I was going to turn to that next. And part of this exercise is to know who the decision maker is, what the timing is, and even if it's a legislative change, for example, or even if the power is only in the director of the DCA's office, it doesn't mean that this board does nothing. We could advocate in favor of that change, or we could lobby the legislature for the change. Or if it's a change in one of our regulations, we can work on drafting the regulation, cognizant that it takes about a year for that regulation to be passed. Or we can advocate for an emergency regulation. It's clear to me that nobody has a magic wand to fix the problem. But these are the options I've laid out. I'd like to know what has to change and what the timelines look like, just so that we just know what our options are. And all that being said, of course, we take into consideration, does the particular option ensure that whoever is practicing optometry is competent to practice optometry? I mean, that is the substance in which Rebecca was mentioning, the difference between procedure and substance. I mean, yes, if we, get rid of the NBEO Part 3, well, what are we making? What do we do to make sure that the board member is the optometrist is competent? Do we, I don't know, have another exam or whatever? All right, Lillian, why don't you speak before we turn to Rebecca and Char to comment further on my options?
Oh, well, here, Rebecca and Shara can speak first. So I just have to at least address this part about getting rid of part 3. So getting rid of part 3 just because you're talking about in the future.
You know, I'm just thinking out of the box right now. I'm just throwing everything out on the table. I'm not sure I'm not sure I'm a proponent of anything.
Okay.
But yeah, I'm just throwing everything on the table.
So I would say that because nationwide the NBEO was predominantly used by all states to get licensure for optometrists, getting rid of Part 3 in the state of California might not be the best idea in case people need to move to another state. Then they wouldn't be able to get licensed in another state.
I get it. I get it. Although in the back of my mind, the Machiavellian part of my mind is if we threaten to get rid of the NBO 3, maybe that'll prompt NBEO to say, oh, well, we'll open another site in the West Coast.
Well, I mean, we've already asked them that, right? But I will also say that it is my understanding that NBEO is looking at revamping Part 3 currently, right? So that's part 1. I think Part 2, what we all have to remember is that the reason why we're having this meeting is that we're looking for an emergency measure right now, right? COVID is happening. All the students, they've all made the appointment, or the majority of them have made appointments to take Part 3 in California. The majority of them are also worried about having to fly. So we're looking for an emergency measure to fix the problem right now and as soon as possible. So a temporary or provisional license would be ideal, and then that they would eventually have to take Part 3 of NBEO when it's safe. If you listen to the public health experts, it sounds like everyone's talking about in 2021, all is when we all might hopefully return to some kind of normal life. That's probably what they're all saying at the earliest. So I think we have to remember that we're trying to work with an emergency measure. And then I think looking forward, we as a board should find a way so that we can have some kind of authority to, in the event of the next pandemic or in the next emergency, because obviously something like this will happen again. So if we can have some kind of authority, that would be great. But that's looking forward to the future. But I think we also have to address the fact that we are currently looking for an emergency measure right now. So
those are all good points. I didn't mean to say that the options were exclusive. I'm just
no, I just wanted to address all 3 of those because I know we're all talking about how and the next pandemic or the next big emergency, but and I think that's something that we definitely do have to address. But at the same time, we do have to address that what we're right now is an emergency measure to address the current issue.
That certainly is the focus. All right, so Sharon or Rebecca, do you want to comment on the pathways are and the timing of these options, so we can see whether? I mean, I think we need to know that to know what's viable.
Can I say something first?
Yeah, go ahead.
Way back in the day when I took the NBEO Part 3, it was not done in North Carolina. We did it at the individual school. Is there any way of setting up a temporary facility, just kind of redoing what we did back then? It worked for some reason, and there are plenty of us out here practicing and we're doing just fine. So having to go to one location and do everything obviously doesn't make or break whether you're a competent optometrist, but is there any way to establish a temporary location where we can do the NBEO Part 3 again?
Deborah, we've asked NBEO and they've said no because they can't guarantee. They just said it wouldn't. They can't do it because of too many
consistency.
Issues. There you go. Thank you.
Then how did we do it before? Yeah. We didn't all of a sudden become inconsistent because we went to one. I mean, you know what I'm saying. It worked before. I just don't understand why it's an absolute no now. I have nothing more.
Okay. All right. So Sharon and Rebecca, if you don't, if none of the other board members mind, can we kind of tell us what our option, what our pathways are?
Of course, I just wanted to make sure if there were any other sort of pathways that other board members wanted to suggest. I think we had some of that discussion, but I just wanted to plainly ask if there was anything else that anyone had another great idea.
Deborah, were you suggesting that we have our own, that California administer its own test? Without a MBO, since MBO isn't going to do it, are you suggesting that we do our own practical test equivalent to
Yes, I am.
MBO through him?
I mean,
All right, so that's
what Florida did for God knows how many years.
Right, but it's written in statute that they have to pass Part 3 of NBEO. So it would have to be in conjunction with NBEO, I think, in order for the students to get licensed. But we have asked NBEO repeatedly to figure out a way to have a temporary site, and they said that there's no way that they could do that.
Yeah, back in the day, California used to administer its own test. It was a state-run test. And my classmates and I, we all got in our covered wagon and we went down to SCCO. And that's where we took the state test, and it was a 3-day test.
I'm competent, aren't you, David?
You'd have to ask my wife and she'd disagree, but okay.
I mean, it would require a statutory. It would require a statutory change, but again, with the concept of throwing everything on the table.
But that's a great thing, though. If we could, going forward, looking ahead 2, 3, 4 years, maybe even part of a strategic plan, that we do have some alternate method of licensure in the event that the NBEO cannot be taken in North Carolina. California can at least administer its own exam, and it would meet all the qualifications where the folks in the state would say, yes, this is a competent examination, and it does meet all standards.
Yeah.
But that's not going to happen this soon. That's years in the future.
Yeah.
Hi, this is Tracy. Could I jump in real quick?
Sure.
So I just want to echo that in terms of long-term. We at OPS are really encouraging boards to move away from clinical and practical exams where you have strong training and school curriculum. They are fraught with inconsistency, reliability issues, cost, bias. I could go on and on, which is why NBEO does not want to move their exam. So if your schools are doing what they should be doing, really focus on a well-written multiple choice test. Most of us are familiar with exams we took in school or at the DMV. Those are not high stakes tests. I can guarantee you that the tests we develop at OPS are strong and robust, and they are scenario based. And those written tests can be put in a situation where you don't run into these problems that you're having right now. It reduces barrier to licensure, and I love the comment about giving your board flexibility. We like to see in regulation a national or state approved exam, so you are not locked into a situation where you have to go with an exam or one association. So we'd be happy to help you with that in the future. Again, I know that's not a situation, but I think you are definitely thinking along the lines where you need to go. So I appreciate that. Thank you.
Thank you. Let's not spend any more time on that option since it is a longer term solution, and it is, and I think Lillian is right. We need to think about items that address the problem at hand. But so David, go ahead.
Okay, thinking in terms of what goes on in situations where we have a licensee who's placed on probation, is it at all feasible for the board to issue a license for somebody that has not passed Part 3, that hasn't taken Part 3, issue a license, immediately revoke that license, and then put the licensee on a probationary period of a year, year and a half or whatever, allowing that person time to practice under probation with whatever terms we want to come up with. And then as soon as that person passes the Part 3 exam, they're off probation and they have an unrestricted license.
I'll add that as option 7. That's very clever and thinking out of the box. It's going to require tons of administrative work by our staff, but it is an option, and I've added it as option 7. So,
if I could just, I think you saw my eyes, but also not only just the administrative staff time to do that, that would engage the Attorney General's office, which we know has been a sore point within our budget. And so then would require the, statement of accusations, the attention of Deputy Attorney General. So I just want to remind folks that that's a very costly, although out of the box potential solution. That one that might not be something our board could absorb. One that our board could not absorb. I shouldn't say might. One that we could not absorb.
Part of the probation would be that the licensee pays for all board fees. They're already $200,000 in debt. This will at least get them practicing, and they can start cutting down on that debt.
And some of the requirements of using the Attorney General, et cetera, are required by statute. We could get the statute changed. So, so why don't we go through all these options, starting with this idea of a waiver or whatnot, and what we can do. My option 2 of just for COVID, someone waves a magic wand to say you don't have to take the NBO. I don't think we have the power to do that, but who does? And how long does that take? Shara or Rebecca?
Okay, and back up just a moment, and I can, let's see, we're talking about option number 1 here, just doing nothing?
No,
we're
option
on
number
to-
2.
Gotcha. Okay, so during COVID, some kind of action. Let's see, this goes back to a lot of the discussion we've had about, I guess I take this one to be very broad. Are we looking at some sort of waiver? Are we looking at, like you suggested, it probably leads to the idea of a waiver, which I think we've kind of explored in this discussion already. Let's see, do you have a more specific angle on what that action would look like?
So an edict that says a graduate does not have to take MBO 3 until the conclusion of the state of emergency.
Yeah,
I think and can practice as an optometrist.
Yeah. So this idea of having some sort of time frame or circumstance frame around it, like during COVID or for this duration of time or during a state of emergency. I think the problem.
No, actually, don't tell me about the problem. Tell me how it can be done, and then we can talk about the problems.
I know. I literally thought, well, I already sound like I'm shutting it down. I know, but it does go back to some of the things we've talked about here with that concept that by making some sort of exception, you're sort of inherently suggesting that requirement is not necessary. And so even if you're attempting to do that within a circumscribed circumstance or time period, what you're suggesting is, okay, these, this particular window of time, consumer protection doesn't require us knowing if you've passed this practical exam. Well, why? Why would we know that during this period of time we don't need that? And then would have to try to resume that and sort of say at some unknown end point, of course, because we don't really have all the facts on timelines here, but at some unknown end point, the board kind of says, okay, now we do need to know that you passed the exam again, well, and as was brought up previously, by the way, what about people before this particular timeline? So we're not comfortable with those folks who haven't passed this portion of the exam, but we are comfortable with these folks who haven't passed it. And I'm not sure why in terms of minimum standards protection, I'm not sure why we would make that distinction or how.
So let me interrupt you for a moment, because those are important details one must consider. But who has the power to do that?
Okay, and that's where we get into that procedural sort of breakdown again, this idea of, the legislature sort of issuing a change in statute that says, oh, never mind. We don't think this is necessary for some reason, or during the
COVID crisis, yes. During this
sure,
crisis, yes,
or I guess theoretically, the governor probably could do something similar. It was mentioned before that currently the governor has already authorized DCA, or the director of DCA, to make some of these types of exceptions, and we've talked about why that probably won't happen there, but that theoretically would be another avenue. Let's see. I think
so Rebecca, it's Tracy.
Yeah,
I'll jump in.
Please.
So I think if you're just looking to submit a waiver, you would just submit it to the director. So if you're looking at not, any pros and cons or anything, you would just direct the board, or, take action to do a waiver to waive Part 3. However, everything that Rebecca just discussed, the director would be looking for in your waiver. So you can certainly, as a board, decide to put a waiver to the director to submit it for her review, but she will go back to Shara and your board and want all of that information. And that's a real key thing that Rebecca said is, how is this group different than those once the pandemic's over? You've let a group go through and practice without passing an exam. Now you're going to tell these other people, oh, nope, sorry, the pandemic's over. Now we're back to it. So you can do that. You can submit to the director. That's not a problem. You just have to justify it. She'll be looking for that.
Yeah, thanks very much. That's super helpful. And I think, let's see, I guess I'm jumping ahead a little bit here, but I want to address this idea about getting rid of section 3, the, quote, getting rid of, because I know I sounded like I came right out the gate shutting down that last one, but
I don't know if we want to spend time on that, because I'm not sure that's something that we're going to
that's why I'm bringing it up, actually. So the statute, as I read it, I'm going to point everyone to the subsection so that way I can kind of better illustrate my thinking. And if someone has concerns with this approach, you can let me know. But if I'm looking at your statute 3041.3, subsection C talks about granting the therapeutic pharmaceutical agents certification. At the end there, it talks about someone who has passed or passes all sections of the NBEO National Board Examination. Then it says, or its equivalent, as determined by the State Board of Optometry. So I read that to give the board some regulatory ability to do what Dr. Montez is talking about, which is have some maneuverability to look at whether there's some equivalent or some alternative to this practical or clinical exam. And then, of course, if we go down that path much further, like I said, you've got your regulatory attorney on the line here too, and she can talk in a little more detail about what that would look like, I think.
Mark, this is Dr. Garcia.
Go ahead.
So along those lines, so Shara was saying earlier that we currently can already license someone with a DPA license without Part 3 being taken or passed. Is that correct, Shara?
No, so we would need to waive Regulation 1523F, which spells out that licensure shall be contingent on the applicant's passing the clinical skills portion of the National Board of Examiners and Optometry examination as provided in Section 1531 in this article and passing the CLRE. So in order to take that DPA route, we would still need to waive, or we would still need to remove that regulation in order to move forward there. Then that's under the board's jurisdiction, as opposed to for a TPA, it is baked in that you have to pass the clinical exam. And that's in 30, 40, well, and several others, but also baked into.
So that's within our to do that.
We have the power to change the regulations. Yes, we have that power within the board.
So along those lines, so what if we give students the option, the choice to continue to take part 3, as they've already, most of them have signed up, but if they choose not to, then it can be waived like you're saying, it can be waived, but they would be DPA licensed until they took part 3 successfully after the pandemic.
The issue with that is that we would, in order to remove or amend that section, we would have to go through the regular rulemaking process. So it wouldn't be a relief to graduates of 2021. It will take,
okay, gotcha,
honestly, 16 to 18 months in order to pass a rulemaking package.
Thank you.
Can I ask a question? So, Shar, what you were just talking about, 3041.3C, board can grant a therapeutic pharmaceutical aid. So basically students could be TPA certified and not just DPA certified, right? So would we just be asking for a waiver of 1531A? And then could they still at least be TPA certified if the board determines that they will accept something, the equivalent of the NBEO National Board? So if students took part 1, part 2, and if the state board were to come up with the equivalent for part 3, and if we could keep 3041.3C and just ask for a waiver of 1531A, which is requiring part 3 of NBEO. So instead of asking for just a waiver, does that make sense?
Yes, I believe I understand the question you're asking. So the equivalent, though, would still need to be measured and and that would engage the Office of Professional Examination Services to ensure that the validity of the equivalent. So it would begin with, or in tandem, the regulatory package to remove the regulation or to amend the regulation, and in tandem working with OPES in order to find an alternate validation or an equivalent to the NBEO. So validating some other sort of source of.
So just for the emergency measure, we can ask just for a waiver of 5031A and then have OPES and the schools work together to come up with an equivalent of part 3, because the part 3 that we're talking about is what everyone prior to 1996 took at the schools of optometry. Because part 3 is what the students do every single day. It's clinical skills. So it's what it's what they do when they're examining patients. So the schools of optometry could theoretically come up with a part 3 that's equivalent to what they're taking part 3 in NBEO, because that's what the schools used to do. Does that make sense?
It does make sense. I think it would be important, and I'm not seeing in the panelist.
Oop, you went on mute partway through there.
Sorry about that. So we do still have Dr. Linser with us and Dr. Montez. I would want to have a better understanding of their process to understand whether or not the process by which you'd find an equivalent, or we would determine that the coursework that's done is equivalent to the part 3 clinical examination, what that time period would like that, what would that process look like, and could it actually be a relief to 2021 graduates? If we could.
So this.
Excellent, thank you.
Sorry, so this is Tracy. Let me ask a clarification question though, Rebecca. So you're saying you'd still need a regulatory change even though the section that you quoted gives an alternative to part 3? Can you run that by me again? Where the conflict is either Rebecca or Shara? Sorry.
That's all right, sure. let's see, I was referring to the statute that talks about the requirements for certification. So in 30, or for clarity, 3041.3C. And so that statute, as I read that statute, especially so in subsection C, it appears to say, they have to pass the NBEO exams or the equivalent as determined by the board. And so, yes, and again, Danny can, I don't want to step on any toes here. Danny is here to provide all kinds of information about regs, but yes, I think that's a good launching point for her, that I believe if that gives you the room and the authority to sort of define what the equivalent is, then the regulations would be your place to do that. And I don't think, I'm not suggesting that puts you back in waiver territory.
Yeah, because that's what I was wondering. Like, even though it's in statute, do you have to have the reg first, or can you do it parallel? I know regs are the nice to have, but does that have to be in place before you start implementing it? I know that's where legal usually gets frustrated with me.
I'm happy to weigh in. Hi there. So the statute is what provides the authority for the board to regulate. So pursuant to the authority that's stated in the statute that the board can either choose the NBEO or its equivalent, the board has engaged in the rulemaking process to pass a regulation. And so to the extent that the regulation is in place and requires that a specific test be taken, then the board would have to engage the regulatory rulemaking process to amend that regulation. And that's done by waiver. It's done by emergency regulations, assuming that the standard for emergency regulations is met, or it's done by the regular rulemaking process that Shara alluded to, which could be considerably. Hopefully that answers your question.
Yes, it does. Thank you. So seems like that this would have some good justification for emergency regulation. We would have to look at data before we could determine what type of exam and how best to do a state exam, but that is certainly an option. I wish I could give you a time frame. I know it would be something that we would want to expedite, but certainly with all of the other projects and so forth, we would, need to incorporate that. But
so Tracy,
it seems feasible.
Sorry, I didn't mean to. Sorry. So if we're looking at like the data of what the different parts of part 3 are already listed out for the students. So if the schools of optometry are willing to make a similar test based on all the test components that are already listed in part 3 for the NBEO, it would be an equivalent.
Yes, but you usually don't have schools developing high stakes board exams. So maybe it's taking it a step further if there's a way to demonstrate they're already measuring that and the board is approving that in that context, or OPS works with the boards. Again, I need to meet with my team and kind of process this, because again, it's since the exam plan is out there, that's great, that piece is done. It's just how do we make sure that the board still maintains its oversight role and the relationship with the schools. But certainly it does seem like there is a good starting point and a potential solution. But again, I would want to process this with Heidi and think about it. Because again, it's really important to make sure the board is protected. So that's what we would want to do. But yeah, I mean, the exam plan's there. We already know what those critical skills are. It's just how we going to make sure they're measured in an objective manner for the board to feel comfortable with the decisions that are made.
Rebecca,
Does that help?
To me, yeah. Rebecca, I have a couple questions. So I'm looking at 3041.3C. It talks about someone, or it seems to apply to someone who is already licensed as an optometrist in California. So is that an impediment? And then my second question is the last line says, or its equivalent. I'm not sure whether that necessarily requires an exam. It's as long as it's the equivalent of the exam. Or wordsmithing a little bit too much.
No, those are both really good questions. I noticed that too, and that point about who is licensed, who's, like you said, it kind of suggests the person is already licensed. So that might be something where if staff weigh in on how they have treated that language in the past. In other words, does that mean somebody who is already licensed comes to take those exams? Because I didn't expect that was the case. To your second point, really quickly, you were saying, I think your second question was about whether or not an exam has to be equivalent to this particular section of the exam. No, I would agree with you. This leaves it pretty open-ended for the board to determine what the equivalent looks like.
So I'll also hope that Natalia will provide some backup here. The process by which one is licensed is very interesting. So when you submit an application, you are immediately processed, well, a successful application. You are processed to be a DPA. Then if you have graduated from an accredited school after 1996, then you can be certified as TPA. So it's been interesting as we've been trying to sort of get our reporting numbers accurate, that within our system, each of the optometrists on our board today have 2 licenses. One is a DPA and one is a therapeutic. Then all of you are also certified in glaucoma. So the statute language that refers to who is licensed as an optometrist in California is because with a successful application, we license you as DPA and then consider the graduation date of that applicant in order to provide a TPA certification. And then again, the graduation date of that applicant is assessed in order to give a glaucoma certification. So it's very complicated in the wording here, but we are talking about new applicants who are seeking licensure under therapeutic pharmaceutical agents, because they would first be processed as a diagnostic licensure.
And I think even if they were, even though they're first processed as diagnostic, then our regs still say that I think 1523F, is that right? Basically still requires these sections of the exam, even at that level. Us back to, they would have to take the exam or its equivalent as determined by the board. Is that fair? A fair assessment of that sort of complicated territory? It is a little twisty and turny, because if we treat it as different levels and you're saying, okay, we're processing you and we're going to sort of treat it at this bare minimum level, then even that bare minimum level in the regs has a requirement to take each section of this exam, because otherwise you would already currently have the ability to say, even without section 3, we're letting you in as a DPA, is my understanding.
Yes.
Okay.
Yes, that is very true.
Okay. So I think that brings us back to your first question, meaning that let's see how I was going to try to wrap it all in here, or sort of summarize, because your first question was, well, does that mean they've already reached licensure? But I think it still takes us back to this idea that section 3 currently, according to this statute and reg framework, is required for licensure, but the board has the ability to further define or determine an equivalent to that exam.
Okay, so I'm feeling a little optimistic there, because it does put some power within this board that we can come up with the equivalent and still get folks licensed as optometrists. So David,
Now, of course, oh, pardon me. Real quick, I do want to highlight Shara's comment earlier, which is a really good point, that unfortunately, I agree. I think it gives you guys more authority and ability to address it. But then, as she pointed out, timeline wise, it maybe doesn't, by going through the regulatory process, it might not address the particular group you're trying to catch now.
that's an important consideration. I want to explore all options, understanding the timing. The timing may be what it is, and what if the COVID crisis lasts another 2 years? I'd rather do something than nothing.
Yeah, exactly.
Even if it's going to take another year and a half. I don't know. Other board members may feel differently. David, and then Sid.
Okay. How do I want to do this? We still have 300, 200, 300 optometrists who only have DPA certification. So we are currently renewing licenses with only DPA, people that never got their TPA. Okay, when I graduated in 81, I got out with a TPA. In 1996, I took the classes necessary to get to a TPA level. In 2013, 14, somewhere around there, those classes ceased to exist, but the board passed a regulation, or had a statute passed where we put into regulation a self-study program where you could go through all the necessary requirements and be eligible to get your license upgraded to a TPA status. So that doesn't require a school to really do much of anything specific for you. Before, you had to take a 65-hour didactic course in a school to get that TPA certification. Now you can do those units online. Is there a way we could still issue a DPA license, which we're still renewing, issue that DPA license, and then these new licensees would be able to either A, take Part 3 of the state board, or Part 3 of the national boards, or take the didactic course so they would be eligible to apply for a TPA certification with the state board. It's a whole lot of ridiculous dancing for somebody that knows this stuff already. They're essentially re-educating themselves on something they know, but it's a pathway to practice. That's all I got.
Okay. I don't know if it's worth weighing in at this point, but I think that it's just worth highlighting that even at the DPA level, the exam itself is still required by regulation, which puts us back in that territory of, do we have, can the board can request a waiver? Would it be granted for all the same reasons we've talked about? Or would it require a regulatory change anyway? And then at that point, you're instituting a kind of regulatory change just for people to be able to operate at the DPA level, is my understanding.
Sid, I think you were next.
Thanks. I had my question.
We totally lost your comment.
Having speaker problems. I believe I have my question answered because of the simple word of and.
Okay, thank you.
Because the School of Optometry, if they graduate from the School of Optometry on or after, who is licensed as an optometrist and who passes all sections, or could its equivalent simply be the exams that the students took upon graduating from college, and our waiver is just postponing the taking of the exam using their passing grades that they were achieved in order to get their graduate diploma.
Yeah, I mean, that's what I was kind of arguing, and Rebecca seemed to indicate that there is flexibility by this board to come up with a definition of equivalent within reason.
The definition of and, but it's and in there. I was thinking of the or.
Well,
And the and be what the school offers in the way of testing.
Well, I think that's what the deans are all advocating. Like graduation from an accredited school of optometry in California is proof of their the rigor and the breadth of education. But then I think other people have said though, like who was talking about like 5% or 3% of graduates who still haven't passed. I think all of the presidents and deans are all saying graduation from an accredited school should be and is the equivalent of passing all 3 parts of the NBEO.
Anyone else? Actually, that triggers another question on my part, Rebecca. Can we, if we come up with this follow the pathway of equivalent, and I'm fairly confident that we can find an equivalent among our schools in California. But would we be required to say, well, if you graduate at any accredited school in the United States, would we be forced to grant this temporary provisional license to them too? Or can we make distinctions?
To clarify while waiting to come off, can it be from California?
Sid, we can't hear you.
California? I think if we narrow it to specify that if they want to practice in California and get a California license, and we are looking for a waiver, that the waiver would be that they were educated and graduated from the California school, so they understood the California way of our practices.
Yeah, I think it's justifiable because we would have the power to examine the California curriculum and the California testing requirements, and we would be able to deem that they are equivalent. And we don't have the power to do that for the other schools outside of the state. Lillian, you wanted to say something?
So we might want to get public comment from the deans also, but there are a number of optometry schools throughout the United States, and they're all accredited. So each one of the optometry schools are accredited. I believe it's every 7 years. So us saying, hey, California schools are the only ones who have good enough accreditation for us to allow this, because there are a number of Californians who are going to school outside of California for optometry school. So I don't know if we could really say only because of COVID, only the schools in California are going to allow this, because you will have people who went to school, in Alabama or Florida and any of the other schools who are Californians.
It's kind of unfair, but I can draw that line. But does anyone else want to comment before we ask the deans to weigh in?
Yeah, I would. This is Jeff Garcia. Yeah, this is Jeff Garcia. So just looking at the NBO pass rate, I realize this is a few years old, this information, but California schools traditionally have always been very strong clinically, but some of the other schools in other states, not as much. So, their NBO pass rates for Part 3 range from 40 to 70% in some of these schools. So to waive that may be a risk. So.
And just to add weight to that argument, our current statutes and regulations do not have any call out specifically for California schools. We accept education from any of the ASCO accredited schools.
So Lillian has suggested that we hear allow the deans to comment at this point. That sounds like a good idea to me. Moderator, why don't we open the discussion up for public comment?
This is the moderator, and I have opened the Q&A panel for public comment. If you would like to make a public comment, please type you would like to make a public comment. I will take all questions in the order they are received. I do have an individual identified as Masha Masoida. Microphone has been unmuted.
Thank you, moderator. I was happy to wait until after the deans wanted to speak, but thank you for this opportunity. So I wanted to go back and on Shara's presentation, I'm really grateful that you all took time to ask a snapshot of what the students feel, and I'm glad you got about 60% responses. I do wish that if you end up asking for a secondary questionnaire, that if you could ask one more question around the purpose of your travel that you completed in the last 6 months, so it doesn't lead to any assumptions, whether it was for business or pleasure, because I can at least say for me and my 63 classmates in the class of 2021 at UC Berkeley, I can't think of anyone who traveled for pleasure. It was merely for externship sites or because they already took part 1 or part 3 or both of national boards. And then as far as the West Coast location for NBEO, I know Dr. Wong mentioned as well how hard you all and the AOA and many other entities have been working to get NBEO to open up a West Coast location. And if you haven't already, I think maybe Dean Hoppy also could provide some additional information as well as the AOA, who, as I learned back in 2018, had worked with several other entities on a task force with NBEO to help them figure out, okay, what is the inconsistencies between the schools that creates the bias that makes it inadmissible for them to be tested at individual schools any longer, requiring the Charlotte location? And the answers were 1, inconsistency bias, and 2, financial. And the closest they came up to was that the most financially reasonable option for them was to create a secondary site in Texas. Dallas, I believe, was the closest. So it still didn't even come to the West Coast. And then they still found flaws in that, so they never went through with it. In the larger scheme of things, I do have a suggestion to NBEO. If the state board would ever like to advocate on that idea, is instead of being worried about the inconsistencies between the schools, if instead of the 7,000 optometry students there are, a fourth of them being fourth years, about 1,500 or so students traveling to Charlotte, instead of 1,500 flights for that, if the proctors at NBEO would visit the schools instead, Oklahoma and Canada, and soon to be Kentucky, not requiring Part 3 of NBEO, of the 25 schools, that only leaves 21 or 22 of them who actually need to be administering Part 3. To my understanding, again, the deans can speak on this, every school should have at least one exam lane that is set up in equivalence to the exam lanes that are proctored at NBEO Part 3 in Charlotte. If the proctors wanted to come from Charlotte to visit each school and set up some kind of exam week for the graduating class to do their Part 3 exam, it would be a lot less travel. And I bet you the students at each of the schools would be happy to chip in and pay for that proctor's travel and housing, and it would still cost less than the students going there, as well as limiting the COVID exposure, as well as creating consistency. So now we've answered the consistency question because NBEO can still do the test that they want to do, and the finances have been answered, and exposure has been reduced for the students, and now the students don't have to quarantine 2 to 4 weeks after they return from air travel in order to take the test, so we don't miss out on our valuable clinical learning during that time.
This is the moderator. I just wanted direction from the board. We haven't had an issue with it up to this point, but are you wanting me to hold public comment to the 2-minute time frame that was originally stated?
Ideally, yes. Are we at the 2 minutes?
Yes, sir, we are.
All right. Well, if the speaker could finish up her remarks, we'd appreciate it.
All right.
Okay, thank you. So one final remark that I think is really important to mention is that thank you for considering all this for part 3, but part 2 is also really important, especially if the COVID or a new flu strain or pandemic pops up. Part 2 is not scheduled until December, so there's a great chance that we won't even be able to take that at testing sites throughout the country. And also, as far as accreditation of the 25 optometry schools, CCO, Chicago College of Optometry, a connection to Midwestern School of Optometry, they are not fully accredited yet. They have a preliminary accreditation status, so I just wanted you to know that too. And last comment, as Dr. Wong said, on NDO's website, they do have the exam information, and it's not just an outline, it's word for word the script that you have to read once you get to the test site, which is one of the reasons that Dr. Cockrell was saying Oklahoma doesn't find the test to be an accurate measurement of skills, and rather a acting and memorizing a script test. But it is all there for you if you would like to evaluate it in detail, word for word of what is tested, if you were to consider an alternative test according to the statutes and regulations that you were mentioning earlier, Shara. Thank you again so much for your time.
So as we get the deans on, if they're there, it seems like we're boiling down to 2 options from my 7. To seek another run at the director's office for a waiver, bolstered by additional information that we've gathered here at this hearing and addressing the issues that Rebecca and others have identified. And then option 2 now is to use the language of equivalent, the term equivalent, and have the board come up with an evaluation process where we can say that something happening at the schools is equivalent to the part 3, and it also may require some additional regulatory changes on our part. So those are the 2 options that that are gelling in my mind. Are the deans out there?
They are. We have 3 additional requests for public comment, and all 3 of them, I believe, are the deans. So I will start with Dr. Hoppy. Your microphone is unmuted. Really quickly, do you want me to hold them to the 2-minute time frame?
Why don't we give them 3 minutes?
All right, will do. Thank you. You are unmuted, Doctor.
Thank you so much. I am really inspired listening to this dialogue. I'm very impressed by the creative options that have been presented and the open mind that all of you are showing in order to seek real viable solutions. Just a couple of thoughts that I would like to share. I really appreciate that we are looking for an emergency solution and that time is of the essence. In addition, I believe that it's very wise for us to think about preparing ourselves for potential resurgence of the pandemic at higher levels than we're currently experiencing that may necessitate additional closures beyond our current experience. So it's always wise to have some options available, and I appreciate that you are looking for long-term as well as emergency solutions. As I shared, based on my background, I definitely have a deep appreciation and understanding of all of the psychometric challenges for validity and reliability of testing. And I think that the combination of the emergency, the potential resurgence, and the challenges for validity and reliability would lead me to suggest perhaps having testing done at the level of the schools may not wind up being the long-term solution. And the reason I'm suggesting that is we're located in Los Angeles County, and we are still subject to closures. And I know from my colleagues in dental medicine that their regional board was not approved by the Los Angeles County Department of Public Health. So I think that I may suggest that transitioning a testing experience to the schools would be quite challenging for those reasons. I'm very energized by the very rigorous and deep discussion about the concept of or equivalent. And I would like to support the possibility of offering an additional certification or additional attestation to the state board on a candidate by candidate basis beyond only the grades and testing that's done as a regular part of the curriculum. If that would be reassuring to ensure that we have done some additional assessments, I believe that my colleagues and I would be very happy to support that. So those are my comments. Thank you.
Our next public comment is Christine Schultz. Your microphone is unmuted.
Thank you for the opportunity to speak again. Dr. Hoppy covered a lot of the things I was going to mention. I think that it's important to add that it's unlikely that a waiver at DCA is going to happen. It hasn't been approved for any other profession, and based on our conversations with DCA, it was really a non-starter. So I'd like not spend a bunch of time on that. But another option would be legislation. A legislative solution is an option, and we can assist with that moving forward. And there's no reason it couldn't be done and simultaneously as working the regulatory approach that would allow, approach OPES and have them determine that what they're already testing at the colleges is equivalent to the NBEO. That makes a lot of sense, because then you could do an emergency regulation to allow the board to waive the NBEO during the pandemic. Thank you.
Last public comment comes from Jennifer Coyle. Your microphone has been unmuted.
Thank you. I echo Dr. Hoppy's enthusiasm and excitement at the creative way you're approaching this. I just want to speak on behalf of SCCO, in particular to the suggestion that perhaps the schools, and I would encourage you to consider all ACOE accredited schools, that we are able to demonstrate we're already assessing elements on part 3 based on what they publish in their candidate guide. We do that for other states, not quite like that, but we do attest that our students are competent and typically they are in more advanced procedures. So having a attestation by candidate, we would be willing to take on that paperwork. Speak for my institution if this were a pathway for our graduates. So on behalf of us, we would say absolutely we would work with you to follow through with any attestation that our students have demonstrated competency.
Thank you. Is that it for the public comment?
No, we did receive one more from a Mr. John Flanagan. Your microphone has been unmuted.
Hello. I apologize. When they said 3 deans, I thought I was included. So John Flanagan, again, Dean of Berkeley Optometry. Again, I just support my colleagues. I think the idea of equivalence is going to be really very important, and we could work with you in any way we can to ensure that you have whatever documentation, attestation, as Dr. Hoppy pointed out, anything that you would require to make you feel more confident of our graduates being equivalent. So thank you.
All right. I'm assuming that is the end of the public comment. Thank you.
You are correct.
Further discussion. Let me start just to open things up. I unfortunately am in agreement with Ms. Schultz that although asking the director for a waiver it would be a noble effort, I don't know if I think the odds are pretty slim. I'm willing to go and engage that effort if the board members want to. It's worth a try, I suppose. On this or equivalent option, we kind of came up with this in the course of our discussion. I'm not yet convinced that it's viable, but I would like staff and legal counsel to come back to us and give us the steps and tell us what needs to be changed in the regulations, what this board what needs to do, what OES needs to do, and kind of lay out the steps so that I know we're on solid legal and regulatory grounds before we make a final decision. But so that's the status of my thinking right now. I welcome comments by other board members. David, sorry, I keep thinking.
I really like to be able to have some temporary or a couple of things that we can present to staff that they can move forward with, because I can just imagine the ridiculous angst that these poor students are going through, not knowing what, do they have to risk their lives to become an optometrist? And I'd really like to be able to give Shara and staff some definite pathways to at least start investigating, so we can show these folks that there is some light at the end of the tunnel instead of just waiting for a vaccine to come around.
Other comments?
How long would an emergency regulation take?
Hi there, this is Danny Rogers, Regulations Counsel. The emergency regulations process, assuming we could make the substantive showing that would be required for that, we would have to prepare the package, give 5 days notice to the public, and then at that point submit it to OAL having given that notice, and then they would have 10 calendar days to consider it.
Sid, did I see you raise a finger or a hand?
Just that if we could look at the other options too, let's narrow them, and then we'll have that path forward to give direction and guidance. And we agree, maybe we have parallel paths going so that we have ourselves covered and not just
about that. Agree that let's look at all the options here and maybe have parallel paths going so that it's not an all or nothing, just vote on one. Cover our bases here, get staff moving, get legal counsel moving, and then regroup. So I like the idea of let's narrow from what you gave us of the 5. Let's start narrowing it down. What are our top 2 or 3 priorities? Run with them.
Okay. All right, I can do that. And go through the list again. So option 1 was do nothing or wait. I don't see consensus for that. Option 2 is I'll call it the waiver option. The ask the director for a waiver of these requirements during this COVID crisis. Armed with more information and a better argument in favor. Option 3 is to seek probably a legislative change so that the board has power to change the requirements whenever there's an emergency. Option 4, which is I think the one we've spent time, some sort of temporary or provisional through amendment of our regulations and through this kind of or equivalent method. Option 5 is to work on legislation, regulatory changes to get rid of the NBEO. And then option 6 is to administer our own California test, create and administer our own California test. And then option 7 is to have people apply, have them suspended, put them on probation. That would probably require a statutory change to eliminate a bunch of requirements that we go to the Attorney General and we go through all these hoops of having them go for the board, et cetera, et cetera. But that's a very creative solution that David has mentioned. So, okay, so why don't I stop from the top? Do nothing has been rejected. Do we have any proponents of trying to seek another waiver with the governor's office.
So are we just talking about waiver of, I can't remember the numbers now, of 1531A, which says that they have to take part 3 in favor of 3041.3C, which says it can be either NBEO or its equivalent?
I'm more simplistic than that. Is asking the director to waive part 3 until the crisis is over.
Well, I think we've heard from so many people today who say that the probability of a waiver is pretty minimal. So if we're going to ask for a waiver, I think it needs to be a little bit more specific. As in, we don't want to just waive part 3, but we're willing to give you something that is equivalent to, if it's like an attestation from each school regarding each student. But I don't think we can just ask for a waiver. I think we have to give them. It's a waiver because they can't take part 3, but we can give you something that's equivalent to show that they are clinically competent and to keep the consumer safe.
Okay.
So I want to be sure the director's waiver authority is tied directly to a regulation or statute. And it is not the authority to add. So it would simply be the authority to waive a current requirement or a current statute or regulation, but it would not give us an opportunity to add an attestation or supervision or any other sorts of fail-safes we think could help justify.
Danny, this is Danny. Sure, I agree with you on that.
Okay.
And just if we did this without some type of an attestation from the school, I think then we end up causing an issue, because there will be that collection of folks who never passed part 3 who are suddenly going to say, hey, you got to give me a license. It's COVID and I want my license. I think we open ourselves up to actually licensing unqualified people at that point, if we can't do it without a school attestation.
Those are good comments. Do we have any other comments in that regard? Because it sounds like 2 of the professional members are against just a complete waiver.
So this is Natalia, and maybe Rebecca and Danny can clarify on this, but I don't think the waivers could necessarily remove the requirement. For example, the CE waiver does not remove the CE requirement. It just gives you more time to complete that CE. And maybe Rebecca and Danny could be more clarify that and see if maybe we just put off the NBO to whatever 6 months or whatever it would need to be.
Hi there, it's Danny again. I will defer to Rebecca on that. She might have a little more knowledge on how the waivers have looked in other cases. I do know that in particular with continuing education requirements, there has, as you stated, simply been an extension and not an elimination of the requirement.
Thank you. But I'm still hearing or feeling hesitation by board members of having a waiver, however temporarily, of the part 3, because those people who have not passed the part 3 would be practicing optometry, right?
I think it's also based on what other people who've spoken today have said, is that if we were to submit a waiver, it doesn't look like it would likely pass. And I know that I believe the deans have already submitted one from the schools and it got denied. So I think it would just be more of an exercise at this point. Or that's my impression from today.
Fair enough. Shall we move to the next option of this or equivalent, utilizing the or equivalent language in the regulations, or actually in the statute? It seems like there's some daylight perhaps there, and that we could probably direct staff to give us, a better evaluation of how that would work and what we need to do, what we need to ask OES what to do, and I don't know, ask what DCA has to do, and whether or not it requires any statutory changes. I don't know. I haven't gone through all the statutes and the regulations to fully understand it, all the ins and outs. But it seems like it's a possibility.
I think the equivalent sounds the most likely because it's taking the place of part 3. And it's also taking into consideration that it's really just the graduating class. So like David said, we're not going to be worried about those who have graduated in years past who still haven't been able to pass part 3. So if we can have an equivalent, if it's a attestation by the schools or whatever is decided, then it's this immediate graduating class that can't travel. It addresses the emergency of the current situation.
Further comments? I suppose staff will probably ask, well, does the board, if we follow this route, does the board want these people to go back and take the NBEO after the emergency is lifted, or are they just licensed henceforth? I'm sure that's a question. Any sentiments on that topic?
This is Dr. McIntyre. I have a sentiment.
Yes.
We're talking about perhaps an additional attestation by the school, which subsequent graduates will not be receiving. If they go back to the NBEO 3 schedule, they're not going to be attaining that attestation. So it's just a temporary measure. I don't see that need to go back and take the NBEO Part 3 if they're obtaining that attestation. What do the other doctors think on that?
This is Dr. Garcia. I agree with that.
As a public member, I'd like further evaluation and thinking about this attestation vehicle. I'm not sold on it yet. I could envision a situation where OES goes and looks at the curriculum of each school and says, okay, this is what they're doing, this is how they're being tested, and that is the equivalent of what the NBEO Part 3 tests. I'm less comfortable with some administrator or professor at a university just saying, I attest that student X has met the equivalent NBEO 3. I can be convinced, but it feels different to me.
This is Tracy. May I jump in? If you are going with
Sure.
equivalency would mean that they really should not have to take part 3, because you're basically saying whatever you have created for that substitution, it is fair, valid, and legally defensible, and therefore they should not have to go back and take part 3. And I agree, again, this would be based on subject matter expert evaluation, whether it's attestation or some other mechanism. The only problem with that is that for portability issues, they may run into a problem where in the future they would have to take part 3 in order to go to a different state.
Thank you. That's a good point. But we're just trying to get them licensed in California, and if they want to practice in another state, then yeah, go ahead. You got to take the NBEO. It's not our problem if you want to practice in Alabama.
I agree. This would at least get them addressed for California.
Yeah, thank you. Any more discussion on this point from the board or staff? Do you need further direction on this, on option 3, on option 4, excuse me? Wow, hearing none.
No, I'm sorry. This is the equivalent, a justified equivalent?
Yes.
So I want to make sure, though, that, and Danny, perhaps you'd speak to this, that we still have to surmount the hurdle of the regulations that specify that NBEO Part 3 is required for licensure. So although we have the leeway, the daylight within statute, we have in previous times constricted that through regulation.
Hi, Sharon. This is Danny. Happy to answer that. So I think that the removal of the requirement is the goal that we're all proposing, but we need to figure out the procedural way to get there. And I think as Shara has outlined, the two ways, well, there's three ways. The waiver we've already talked about extensively. The regulatory ways are through, and the other regulatory means is through the regular rulemaking process that can take anywhere from 12 to 18 months, more probably towards the 18-month time range. The emergency regulation hurdle has a specific legal standard that has to be met in order to use that vehicle. And that is, an emergency is defined by statute as needing immediate action to avoid serious harm to the public peace, health, safety, or general welfare. So in this particular instance, optometry students would argue that the harm is that they're not able to get their license and practice because they're not able to take this aspect of the examination. But the statute really speaks to it being a concern for the public. The word public prefaces peace, health, safety, or general welfare. So the standard doesn't really look to see whether a particular class of people would benefit, which here are optometry students. It more looks at whether the need to proceed by emergency helps the public health or the public safety. So here that may be a difficult standard to meet if we're looking to benefit optometry students who, as was talked about earlier, they have less of a direct role in assisting during the COVID crisis, even though they may have diverted certain patients from the emergency room, which is would certainly be a good argument, a good piece of data to cite. If we could gather the data to support the contention that allowing them to not take this examination would meet the standard, we could use that means more easily. But if we don't have the data to cite, such as what I've just cited, it would be rather difficult to proceed via that route.
Those are excellent. That's excellent advice. If the deans and the COA are listening, I would ask that you compile the evidence, testimony, whatever, to meet that standard, so that we can create the record that the emergency regulation is necessary for the public safety. I know there's been some comment in earlier public testimony on earlier items, but as Danny has pointed out, I think we need a much more, we need a stronger record before us to make that point. So I think that's your homework, because that's what we need. So let's hold off on that discussion for the time being. We can discuss that later or open the record up later for that input. Why don't we knock off the other options per Sid's suggestion? Option 5 was get rid of the MBO3 altogether. I didn't see an appetite for that yet. Seems like a long-term project that has been proposed. Sounds like option 6 of creating our own test is also a longer-term project that wouldn't address the immediate situation. Option 7 of suspending them and putting the applicants on probation. I know staff hates that, but I'm still a little intrigued by it if we can get the statute changed in the legislature so that, we have this kind of interesting mechanism putting people on probation. But I'm open to more discussion about that. Anybody? Sharon, you still want to say what a bad idea it is? Rebecca's nodding her head as well.
So we don't currently have the authority to license these folks. And so the authority to license and then put on probation for an infraction that has not occurred does not appear to be a pathway. If we were to find some way in which that could work, very clearly it's not a financially sustainable proposition for the board. Moving through the accusation and statement of issues, the statement of issues process with the Attorney General would not be supported by the fund allotment or our fund allotment for the fiscal year.
Okay, fair enough. Any further discussion on that option? Okay, so I've lost count. It sounds like we're left with one option. Am I correct? Can someone correct me?
I believe we have two options, and I apologize that there wasn't an appropriate time before, but I had intended to register within our public comment that we did receive a letter from Senator Glazer, who of course is the chair of the Senate Committee on Business Professions and Economic Development, much like the statement given by the representative from the assembly members. There is a support for our looking to alternatives and a support for us to encourage the board to consider additional options for those applicants who may not be able to travel across the country safely at this time in order to complete their required exam. And of course, urge that any alternative pathways the board evaluates balance applicant safety with the need to demonstrate competency that ensures patient safety. So I believe we have the two options. One of determining a timeline for justification or equivalency of justification, possibly followed by the support of our chairs of both the Assembly and Senate Business and Professions committees in making some sort of urgency bill as a part of the legislative process.
So that support is great. Let me ask Shara, maybe Rebecca, this question: if you were asking Santa Claus in the legislature how to solve this problem, what would you ask Santa Claus to do? And we just go to our two legislators and say, change this law and you'll fix the problem.
So in other words, if you basically can ask for.
So I think that without legal perspective, I can give Rebecca an opportunity to get back to us. That what we're looking for is a significant change to the statute. Rebecca, you are back. I apologize, please.
No, not at all. There might be a little background noise still. Okay, so you're kind of saying, oh, if we had a magical ability to fix this in one fell swoop with the statute being changed, what would we do? I think the problem there is that it still goes back to what the board and potentially OPES needs to assure itself that it has licensees who are meeting minimum standards for consumer protection. So I say that because even if the legislature were to say, okay, we'll just obliterate the requirement for these portions of the exam. I mean, assuming that's, assuming that's something they would do, right? Then where does that leave you in terms of consumer protection? Does that mean that you've already sort of considered this portion of the exam or these portions of the exam to be kind of useless or not helpful in determining if people are meeting entry-level standards? That's what I'm seeing. I mean, unless there were a way, it's not, as far as I see, it's not in statute that your candidates have to travel. it's not in statute that they have to, spend money on the exam. What's in statute is this exam or something equivalent that the board sets out for itself. And so even if the legislature took a big swipe at either of those things, I think you would have to know, or then you'd have to be able to assess whether or not that meets minimum standards that you're comfortable with, or as I said, that OPES is comfortable with from that psychometric point of view.
Okay, it gives me two thoughts. One is, OPES is saying get rid of Part 3. I mean, the legislature could do that, right? Let's get rid of 3. I mean, that could be the ask if our schools are that great in producing competent graduates. The other legislative ask could be to give the Board of Optometry the authority to suspend these requirements in times of emergency. I mean, you can define those words however you choose, but to give us more authority rather than having to run to the director's office or something like that.
I think a couple things. One is that your statute doesn't currently say take section 3 of this exam. That's actually in your regulations. The statute just says do what the NBEO, what their national board examination is, and then your reg describes the 4 different sections. So I think even the legislature probably wouldn't be in a position to specify removal of that one section, at least not to carve it out in that way. Probably wouldn't be as likely. And then let's see, your second point was this idea of timeliness, of addressing a specific window of time. And I think that gets back to, I know we're talking about magical hypotheticals and sort of just the ability to do anything. But I think, again, from the board's standpoint, that puts you back in a position of, well, why is it that we're comfortable with these standards for a few months, but not after that, or for a few years, but not before that? So that's the question that brings to mind.
Okay. I mean, on the latter point, I'm okay with it. We're in an emergency, right? And I'm, under these circumstances, I'm comfortable with it. But, all right. So what is the board's pleasure? I think staff has some direction in terms of trying to change the regulation. We need support from the deans and COA to build a legislative record as to why this is essential for public health and safety. We have to have that regulatory evidence, that regulatory record to make this into an emergency regulation. Otherwise, we're on the regular regulation road, and if that's the case, that's the best we can do. Sorry to be talking so much. I want to welcome other comments.
I think you're right, Mark. If the evidence can't be presented in a convincing fashion, where the director or the governor's office, if they don't feel comfortable issuing a waiver or allowing us to make some type of an emergency change, I don't think we have much of a leg to stand on. And we just have to take the long-term look as to prepare for the next pandemic or the next emergency and be ready to deal with it at that time. So it's really up to the folks that we've spoken to put something together that will give a convincing argument.
If we can't make the standard for emergency regulation, I'm okay with putting it through the normal regulatory process. It takes a year or so, but at least we're moving that direction, and who knows how long the pandemic is going to last.
We have to move in that direction anyway, because this isn't the first pandemic that's going to happen anymore.
Yeah. Any other comments? Shall I open it up? I'd be curious to open up for public comment one more time. I know it's 4:51. It's been a long day, but I think we'd benefit from comments from our experts. Moderator?
This is the moderator. I have opened the the feature for Q&A. If you would like to make a public comment, please submit that you would like to make a public comment. You will be given 2 minutes with a 10-second warning. An individual identified as Elizabeth Hoppy, your microphone has been unmuted.
Thank you so much. Again, I'm very inspired by all of the creative thinking and all of the problem solving by the members of the state board. I would like to address one specific concern that has been identified as a potential for licensing unqualified doctors, and that example was given for someone who has had multiple attempts at the NBEO Part 3 and has not yet been successful. The example that I would like to share is related to our College of Optometry admissions process. And as we had the NBO closures this past spring, we also had closures for the testing for the OAT examination, the admissions test that we utilize to make good admissions decisions. My admissions committee looked very hard, very long at what options would be available. And they did make the determination that a candidate could apply utilizing records from the GRE exam as a substitute or an equivalent to the OAT exam. However, in their process, they did stipulate that it would not be an alternative for someone who did not score well on the OAT exam because of the exact same concern that has been expressed. So I believe that any hesitations or any limitations could be worked out in a procedural matter, such that if you had an applicant who did not have a good track record with multiple attempts on NBEO, they may be considered differently than an applicant who had never attempted or who had one or two
20 seconds.
attempts. That's really all I wanted to say is I'm inspired by our discussion, and I think that the devil's in the details, but I have a great deal of confidence that you could work this out based on procedures. Thank you.
Thank you. Any other public speakers?
Our next public comment comes from John Flanagan. You will be given 2 minutes. Your microphone is unmuted.
Thank you so much. Again, I also want to take the opportunity to thank the board for this, for your dedication to this really difficult topic. I did want to say, though, just a final reminder that what we're trying to do is find a solution for an emergency situation, and an emergency situation that's happening now. And you know, I just try and plead that we keep focused on that. There's every reason why this will be difficult. But, you know, I honestly believe that together, if we all keep that emergency idea in focus, that we can hopefully find solutions for our students today. So thank you.
Thank you. Any other speakers?
Yes, our is from Christine Schultz. Your microphone has been unmuted.
Thank you so much. This is Christine Schultz representing the California Optometric Association. I just really appreciate everyone's efforts here to find a solution. I will happy to work with finding, you know, support for the emergency regulation process. It's hard for me to imagine that our students wouldn't be considered members of the public, so I'd like to investigate that a little bit further. But I'm definitely willing to help, and willing to help on the legislative front too, in working with legislatures to find a solution. It seems to me that they should be able to, you know, overrule some of the regulations that are there, and we can work on that as well. So thank you.
So, staff, how quickly can you get back to this board with the game plan? I would recommend that we provide the legal standard for an emergency regulation to the deans and COA so they have it in black and white and they know the target that we're shooting at. But staff, how much time do you need to come back to us with something? So I guess we can, you know, we try to either meet again or even have possible regulatory language available to us.
So I think that comes into again, the process that we discussed, that Tracy mentioned, of course, comes into play in that. So I think that bears heavily on the equivalency. I think that there is a willingness on the part of our legislative chairs to discuss what sort of change to legislation could occur. We are currently assessing the agenda for the October 23rd board meeting. That, unfortunately, though, we are finding will need to be heavily, pardon me, lots of extraneous comments, that will have to be dedicated to 3 petitioners for probation hearings that must be done within the public, must be scheduled with with an administrative law judge and a court reporter. It had been our sort of brainstorming to suggest another meeting in mid-November that might give the staff an opportunity, because of course we are looking at the need for the board to review our responses to the sunset review questions, as well as our strategic plan. So I think it's difficult to give you an exact timeline, but there is an intention for us. We have a date set for 10/23, that we have probationer and petitioner matters to discuss, likely needing 3 to 4 hours of attention by the board, and then the scheduling. And then there is this opportunity in November, but I'm not able to give you a clear timeline, knowing that we'll need to take a look at a sweeping change in legislation, or a very quick turnaround time in the ability to develop an equivalent, or to verify an equivalent.
Thanks, Shar. I must say that's not very satisfying.
So this is Tracy, if I may jump in.
Sure.
I have some thoughts, and I'd like to maybe at least by October to give a written memo or something after OPS has a chance to talk with Shara and legal, and maybe the executive team at DCA, just to flesh out some of these ideas. But certainly we could give you a perspective in October or November. It would not be a moving forward, this is what we're going to do, but at least maybe a timeline or something. But I definitely think we need to just chat with Shara, but we could give you more concrete thoughts either in October or November from our perspective, OPS's.
Okay. Well, I mean, I envision something, at least as a first step, is a one-page roadmap of what needs to be done in terms of changing regulations, or changing a statute, saying what this needs to be done in order to implement the board's sentiment. And then from OPES, a one-page statement as to, in order for X, whatever X is, to be the equivalent of the MBEO exam, Part 3, we need to have X, Y, and Z satisfied. Whether if it's an attestation, then X, Y, and Z. If it's kind of acceptance of the curriculum of a particular school, it has to be X, Y, and Z. Just or the standards that you would apply in order to make the determination of whether something is equivalent. So with that kind of reduced expectation, what do staff and OPES think?
I think we could have something by the November meeting for sure in terms of what a roadmap. But we actually explored this attestation part with another program, so it's something we're familiar with.
I see.
So my wheels are spinning right now.
Okay. Well, as kids say, I'm not the boss of you, so I can't make you put a deeper timeline or a quicker timeline. Shara and Rebecca, can you give me a one-page, this is what needs to be changed, these are the regulations that need to be changed, or this is the statute that needs to be changed, document?
So I think there's first the barrier that we need to be sure that we have the substantiation for this as an emergency in order to run an emergency regulation package. I think that's going to be a very big hurdle. So I think it's first trying to surmount that hurdle. I think that
I disagree, actually, but go ahead. I'll tell you why I disagree in a second. Go ahead.
I think that without the ability to do that, to very clearly demonstrate consumer harm, then we are looking for a legislative change. And as Rebecca mentioned, we are further constricted by our regulations. So what we would need is a legislative change that is sweeping so as to not give authority to the regulations that will take a year and a half to change. Then, of course, we're also constricted by the legislative session in that the legislature does not return until December 1st for the swearing in, with an adjournment until the beginning of January.
So I'm not asking for a timeline. I just want to know what regulations need to be changed and what statute needs to be changed. Maybe I'll just reduce my wish list to that.
I think that we can give you a list of what statutes need to be changed if we were to follow a path of looking for sweeping legislative change.
No. I want if we were to go toward the path of, I'm sorry, I was not clear. I was not clear. If we were going down the path of trying to come up with a way that the board can say an attestation or something is the equivalent of the MBO3, to use for that route.
Certainly, and the regulations that are in question are here within your materials today. In item number 4 on page 8 of your packet, I'm sorry, actually beginning on page 7, you've got the relevant statutes, and then on the second page, page 8, you have the relevant codes within the California Code of Regulations.
Okay, well, I get it, I see it on the page, but kind of walk me through that. I mean, we can do this offline, I suppose. It doesn't have to be in a memo or something like that. But at some point, I want to be walked through as to, okay, what exactly needs to be changed in these statutes, in these, or what else the board needs to do.
So I think what might be less relevant than the code sections themselves, or excuse me, what might be more relevant would be what it is the board is looking for. So you've already started to specify that you're now talking about what would be the equivalent of section 3. That kind of narrows it in scope. So in other words, I think it matters less what numbers we're talking about, what regs those are. I think what that tells us is we're in the territory of regulatory change, and then we're looking at what that means. What does equivalency mean? So it's not about, I don't think it would be so helpful to write up something that sort of pinpoints you on what reg that is. I don't know that provides you the help you need. I think what you need is to clarify what that equivalency looks like, and then that way you're kind of along the reg process, and your regulatory attorney can take what it is you're looking for and help you guys turn it into a definition of the equivalent.
Okay.
That's
fair. And so let me withdraw my request. Let me think about look at this regulation. Let me think about what you just said, and then I'll renew my request with staff later as to what I need to what we need. But I think you're hitting the nail on the head as to.
And I think if that's the case, sorry, I didn't mean to cut you off, of course. I think if that's the case, then maybe what would be helpful to staff at this stage would be, because again, our agenda item here today is what are alternatives to this exam? What can the board do to create alternatives to this section of the exam? So what might be helpful for staff at this point is if the board were to make a motion to the effect of what you were saying. So if the board, as a body, took action to say, yes, let's have staff bring back reg language that describes a potential equivalency, then again, they're working out the nitty-gritty dynamics that you're talking about with that potential memo. They're working out those details about where that is, where it's appropriate to put it, how is appropriate to say it. But then you're able to say, does this achieve what we're looking for? So that's the board level action is, one, today we're discussing alternatives. So what comes from that is if the alternative we find most appropriate or helpful is seeking this regulatory change, then we can take action to say, hey, staff, let's work on something that allows us to express our board level determination of what that is. What does equivalency mean? Does it mean we're creating some structure of supervision? Does it mean we're saying schools are saying these folks are good to go? You know, what does that mean? That's what the board can weigh in on. And then of course, yeah, go ahead.
That's fine. That's I'd be happy to make that motion. I wasn't there yet. I was not yet sure that we could do it via a regulatory change. And so if you think we can do it by regulatory change, then let's move forward.
Just a point of order. I think this is the time in our agenda when we'll need to move forward to number 7. You do not have the ability within item number 6 to take action.
All right, so we're on item 7 now.
Well, okay, so action can be taken on any item on the agenda.
Okay.
It's noticed. So I wouldn't, yeah, I mean, I'll take a second look now just to verify, but I don't think that is necessarily a reason to shut down this discussion. So I'll take a quick look now.
So I guess now is...
You've got a couple different places on your agenda that talk about the board taking action. So I'm comfortable with that if there was action that came out of this discussion of alternatives.
Right. And we're not really taking any action. We're asking the staff to come back with...
That's true.
With a plan. We're not adopting a regulation or anything like that. We've narrowed down the options, and we're not passing anything. So
it's a good point too.
Shara, what else do you need from the board at this point?
I think it's as Rebecca stated, just a clarification that what we're looking for is the staff direction to work with OPES in order to understand what could be a valid option for equivalency that would then inform the regulatory language that would need to be developed. Concurrently, we are to work with the schools and school and colleges and COA to develop a defensible justification for, or substantive justification for the emergency regulation. Is that, I want to make sure that that's the path that we've chosen.
That's perfectly stated. Do we need a motion for that, or is that just simply, we're not really taking any action. It's just kind of direction to staff to bring something back.
I think given the variety of options you all have discussed, I think it would help provide security for staff if the board took action as a body, and in other words, made a motion and voted on it.
Okay.
I will make the motion that Shara just stated.
Do we have a second? Sid Brandwein seconds. All right. Do we need to take a roll call, or can we do this by consensus?
It would be preferable to take a roll call vote. Thank you.
All right. Is Deborah still on the line?
Before
it appears that we did lose Deborah.
which means you do not have a quorum, correct?
All right. Well,
I do just wanted to that now that a motion has been made, before we take the vote, there would be the need for public comment. Am I correct, Rebecca?
That's right. And of course, I'm trying to do a tally across the, yeah, you let me know if you guys have a quorum to even be able to act at this point.
well, I'm not. We need 6, right? We need 6.
You have Jeff now. 1, 2, 3.
We're missing.
That's right. I think you guys are comfortable. But of course, I'm scrolling on WebEx to count you guys.
1, 2,
There's
3,
5.
4, 5. No, we don't have. If we don't have Deborah, we also don't have Glenn.
Oh, yeah.
Oh. Okay, so now you have 5 and you don't.
I do have, yeah, I'm looking at my call-in or my attendee list, and I do not see Deborah listed.
Okay. Well, that is a technicality. However, I think absent the motion, staff does have information from us. We are not, again, we're not taking action. We want some information and options brought back to us at some point so that we can take action.
Treated as suggesting a future agenda item, which, we're getting a little dicey, but I think that suffices.
Okay.
Particularly since the meeting is effectively shut down after this without a quorum.
Right.
I believe, just one moment, that the call-in user 4 is audio for Dr. McIntyre. Madam Moderator, can we check to see if that is the case?
I sure can. Calling user number 4, I have unmuted you. I will not be able to promote you to panelist.
Can you hear me?
Is this Deborah?
Yes, it is.
Okay. I cannot promote her to panelist.
Can I still vote?
Yeah, I don't see why not. It seems like a procedural distinction here for WebEx, whether or not you're considered a panelist or not, I think.
You can vote.
We're unmuted at the time, but I will not be able to mute her, or else she will not have the ability to unmute herself at this point. So unfortunately, when you have a call-in user, it loses the functionality to promote them to other roles. And I will, if she wants to participate for the remainder of the meeting, she will have to stay in the attendee on an unmuted status, meaning you will possibly be able to hear any of the background noise that is occurring from her line.
So I think what we'll need to do, what works, right, we're at this point where if you're going to move forward with the motion, then we can mute her for public comment so as to allow any public members, any participants or stakeholders to give comment. And then after that time is done, we can unmute Dr. McIntyre's microphone in order to allow her to be a part of the vote.
First, Deborah, did you hear the motion?
Yes.
Great. All right. So can we take other public speakers, if there are any?
So this is the moderator. I am opening the Q&A panel now. If you would like to make a public comment, please feel free to submit that you would like to make a public comment. I will take all requests in the order they are received.
And members of the public, you can hear the sentiment of the board. We're all going to vote to pass this, so you don't need to nudge us any further.
At this moment, there have been no requests submitted. Would you like me to close this feature?
Well, we have to allow Deborah to continue to participate.
I have her manually unmuted. You're just not going to see her moved to the participant panel.
Thank you. So, any other board discussion? Can we, Deborah, can you call a roll call from where you are, or should I do that?
I'm going to have you do that. I got kicked out of the building where I was at. That's why I lost connection. They had to close. So I don't have my information in front of me.
All right. So I will usurp the powers of the secretary and call the roll. Dr. Wong.
Aye.
Dr. Turetsky.
Aye.
Dr. Garcia.
Aye.
Ms. Brandvine. Sid? I saw a thumbs up. We'll record that as an aye. Dr. McIntyre.
Aye.
And I will vote aye. So the motion passes with, oh, and Dr. Kawaguchi is absent, so all ayes and one absent. So I believe that completes item 7 for the time being. I'll work with...
6, but yes, I think so.
Oh, I thought we moved to 7 also. All right, so item 6. Any further discussion on item 7, which is discussion of consumer applicant employment impacts and possible action to adopt a plan for alternate competency verification. I think we've pretty much covered that discussion. I see a complete nodding of heads. Do I need to ask for public comment on that? Yes.
Up to you, but you're not taking action on that specifically. So
all right, so
it's been captured. Thanks.
I think it's been captured. All right, last item is adjournment. Thank you very much for a very long but very informative meeting, and I really appreciate all of us working together to move this ball forward and try to come up with a solution given all the constraints we're under. So we'll either see you in October, the next regularly scheduled meeting, or if we have to schedule another special meeting. All right.
We will.
Thanks, Tracy. Thanks, Danny. Thanks, Rebecca.
Thanks. I'll just be meeting on October 23rd.
Thank you.
We'll see you all then. Thank you for your time.
Appreciate it.
This is the moderator, and I will now be ending this event.